Hello, 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 my friends. Jill Osborne from the Interstitial Cystitis Network. It's one of those mornings. It is Sunday, December 11th. It is time for another IC support group meeting. Of course, now everybody's getting ready for the holidays, and so it is what it is. If people have questions, we'll take them. If not, well, wish you well and hope you have a great holiday weekend. Making Christmas cookies or sending Christmas cards, right? I need to send our family Christmas cards. My purpose in doing these meetings, hi Ann, is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody telling you that this is all in your head. I don't want anybody telling you that you're damaged goods. I don't want anybody disrespecting you, giving you no hope, taking your hope away, telling you that you're not a good wife, a good mother, a good child. Baloney. You are hurt. And just as somebody was hit by a car, needs care from their family, well, so do you, because you also have an injury or trauma to your pelvis. And, we still have so much work to do. We still have doctors who are telling patients that it's all in their head. We still have family members that are disrespecting us. So what are we going to do about it? Shannon says Christmas cards out and finished. Good for you, girl. I have had way too much trauma this month to be ahead of anything at this point in time. I wish. So yesterday we had our big international IC meeting. We had representatives from countries around the world as patient groups got together to try to think about where we need to go in the IC world and what can we do to help other countries that are just getting started. And the IC Network, because we are the largest support group in the world, I'm very honored that I can share some of the wisdom that I've learned over the years, right? One of the things that we've learned over the years is that support groups come and go. A support group is dependent upon the people who are willing to step forward and make it happen. And many leaders burn out very, very quickly. I didn't burn out because I love my job, but the vast majority of support groups do. We surveyed all the IC support groups in the United States last spring, and all were done but one. COVID did that. Angel says, I'm so thankful for you. Thank you, Angel. Stacy says, thank you for doing your videos. Thank you. Gosh, I really mean, oh my God, I didn't put my thingy in. You guys are going to see my missing tooth. I just want to be a support group leader. I just want to try to give you some insight, some comfort. I want you to know that you're all alone. I'd love to sit down and just have a meal with you, and I'd love to hang out. And because ultimately, in the end, we're here together for each other, right? We are. Now, here's the deal. I worked all day yesterday. I got up at 6 and did two presentations for the international group yesterday. And then I worked for several hours afterwards. So my eyes are completely burned out. I've strained my eyes so bad. We will see how long I last. Stacy said, I've noticed the burnout issues as well with people running IC bladder health information. Yeah, absolutely. Especially, God forbid you be doing it on the internet, because you got to have a really thick skin. No matter what you do, people will criticize you. That's the tragedy of the internet today. Back before we had social networking, patients gathered on our website, and I have trained support group leaders who stepped in and solved any problems and made sure it was a nice, happy, joyful place where you could be heard and get the support you needed. But the internet has created a whole different side of society, and it's very dark at times, and it's very mean at times. And it's shocking that people would go into a support group meeting and attack each other, and they do. And so if you're looking for a safe place to come for support, come on over to the IC Network website, because we don't allow that. We try not to allow that to happen. And Stacy says, especially in this age of misinformation, I can't even imagine. Yeah, exactly. Hi, Gay. How are you doing, Gay? I hope life is treating you well. Shannon says, on January 4th, I'm talking to my urologist about pelvic organ prolapse. My physical therapist said to talk to my urologist about getting a pessary. Does it hurt, or what should I expect? So here's the deal. You have to understand that your pelvis is a very small confined area, right? You got hip bone, tailbone. Well, this is a better example. Tailbone right in the middle. And of course, we have a lot of muscles that help us move, that help us walk. We have a lot of nerves, we have a lot of blood vessels. And then, of course, we have all these organs. We've got the bladder, we've got the reproductive tract, and we've got the bowel. And they do not operate in isolation. They are very, very connected to each other. And this is what I call the chicken versus the egg dilemma, which comes first, the bladder symptoms or the pelvic floor symptoms. The odds are you might have a little bit of both, because you can't not. They're too interconnected. If your bladder's screaming in pain, your muscles are going to get tight to protect you from that pain. If you've suffered a muscle injury and your muscles are tight, your bladder's not getting good blood supply, and your bladder's going to slowly have problems too. So having a prolapse means that the skeletal muscle, kind of at the base, the base of the pelvic cavity, has become weak, and it's not holding organs in place anymore. So things are starting to fall. So why does that happen? Well, that can happen with aging, the loss of estrogen. As we lose estrogen, our muscles tend to get a bit weaker. I notice now when I do my walk, sometimes I feel like I might leak a little bit. I usually don't, but I feel like it. You can have pelvic trauma from an accident, from sports. If you are a runner, many runners have problems because their running has traumatized their pelvic floor to such a great degree that they also have a prolapse, and they also have to compete with pessaries. So when you have a prolapse, basically things start falling out of you. They start falling out of your vagina. And so your bladder can kind of move, everything can move around. And then once they start falling, that's not a good thing. So the first thing that they can do for a very, very mild prolapse is a Kegel. Because if you strengthen those muscles, it might put things back into shape, right? But of course, for many of us, we have hypertonic pelvic floor muscles, and the last thing we want to do is a Kegel and make it tighter. An extreme version of what they can do, especially for women who are no longer going to have children, is they can actually sew the vagina shut so that nothing can fall out of the vagina. And so that's often done with elderly patients. They can give you a pessary, and a pessary is a structure that goes up inside of the vagina, and it stays in place and it pushes things back up where they're supposed to be. Pessaries are, there are a lot of different, so you're asking, do pessaries hurt? No, they're not supposed to hurt at all, but it's about finding the right size and the shape for your body. And so there's going to be some trial and error here, and you've got to be really verbal and communicative with your doctor and let them know, no, that doesn't feel good, or okay, I can handle that. Size matters. Some people use a smaller size. Some people might use a little bit of a bigger size. And so a pessary is for that point when a Kegel will not work. Those muscles are just stretched out. And then ultimately, if the pessary isn't doing its job, they might need to do surgery, a pelvic organ prolapse surgery. And this was very, it's life-changing. Sometimes it works, sometimes it doesn't. This was the center of the whole vaginal mesh debacle because they were often using this polypropylene mesh, which we since know is really quite damaging. They would put this mesh up in your body and kind of tack it around, and it would become infected and all sorts of stuff like that. So today we don't do pelvic organ prolapse with meshes. They want to use your own native tissue when they do it. Now, the other big challenge when you're having a prolapse repair is the skill of your surgeon, because there's a natural tension to these muscles, right? And so when the surgeon is trying to repair the prolapse, they have to use their fingers to tighten it to the point that it feels like normal, good muscle tone. If they leave it too loose, you're going to have problems. If they leave it too tight, it's going to be quite painful. And I worked with one patient it was just way too tight on both sides. And the surgeon waited a year, but when they finally went back in a year later and released it, she was so much more comfortable. And so as the AUA guidelines say for IC and for bladder removal and all those other surgeries, it's really, really, really important to have a very, very skilled doctor. You don't want a newbie doing this very finesse required surgery. And so I think the pessary is a good shot. Let's give it a shot and see what you think. Hi, Ann. Ow, God, my neck is really tight. You know what, you guys, listen, I have not had a day off now since for 8 days, 9 days. My body's a wee bit challenging right now. Ann says, what valve near the abdomen helps with constipation? My physical therapist mentioned it. I don't know. I don't know. I don't know. What valve? There are lots of valves in the abdomen. So I don't quite understand that. Hi, Renee. Hi, Deborah. Shannon says you're at number 2. I mean, Shannon says your physical therapist says you're at number 2 with respect to prolapse. Okay. And she says, interesting. I was a cross-country runner in high school. And that's where we see this the most in athletes or with long distance runners, hon. A lot of those marathon female runners, those really competitive ones in their 20s and 30s, actually are using pessaries. Everything okay, Dad?
Huh?
Everything okay?
Yeah, she had a bad night. Stay a little longer.
Mom had a bad night. All right. Nobody wanted to get out of bed this morning. I didn't want to get out of bed or out of my recliner this morning. I don't sleep in a bed because my jaw starts to dislocate. I haven't slept in my bed in 3 years and I miss it. I want my bed back. If anybody has any secrets on ligament laxity, my ligament on this side is stretched out. So whenever I lay on my side, it goes and it starts to dislocate. And I don't like that. It's awful. Let's go back here for a moment to something that Stacy said, and that is in this age of misinformation. And I think it's important. Hi, Lakeet. I think it's very, 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 very important that we talk about what is the misinformation that's circulating in the IC world. Now, again, because I was literally the person who started talking about a lot of this online for the first time, or at least was really down with the first few people who did it. The first misinformation that used to circulate through the IC world was that colloidal silver would cure IC. And of course, we now know colloidal silver is literally labeled one of the most dangerous over-the-counter supplements out there. There's no silver naturally occurring in the body, and putting silver in the body doesn't really make sense because it's got to go somewhere. And that's why people who take a lot of silver, their skin turns gray because it's depositing the silver molecules throughout their body. So there's no evidence that colloidal silver is helpful for IC at all. Hold on. Debayman Sarchichi on Facebook says, can ovulation give you flare-up? Absolutely. And Renee says she has ligament laxity in her jaw too. Yeah. Okay, so fad number 1 was colloidal silver. Fad number 2 was antibiotics. And back in the old days, we were dealing with Dr. Paul Fugazzato. We call him Dr. Fuzzy. A wonderful man. I met him. I had lunch with him. It's the sweetest, nicest grandfather you could ever meet. He was a PhD who ran a lab in South Dakota, and he believed that every IC patient had what he called a fastidious infection. And back then, we all sent him urine samples, and they all came back positive, and we pretty much all did long-term antibiotics. And many of us ended up with really bad fungal infections, myself included, because of those long-term antibiotics. And of course, now we know from urinary biome studies that the IC biome is no different than the normal biome. There's no evidence at all in these very, very important biome studies that IC patients have a funky bacteria in their bladder causing this mysterious disease. And I know that this has been our most long-term pervasive misinformation on the internet. And we were talking about it actually at our international meeting yesterday, because I know of one very, very, very important IC researcher who was literally chased off of Twitter by these antibiotic bacterial theory people. And to lose his voice in the whole discussion was just shocking. And I had a talk with him a while ago, and he said, no, I'll never go back. I'll never go back. And which is a great tragedy. I don't know where we're all going to go with Twitter anyway. Elon Musk has destroyed that, that's for sure. Another fad that we had was that magnets would cure IC, and there were people out selling magnets for you to put under your mattress. Of course, there's no evidence at all that that's going to help, and you certainly shouldn't do that if you have a pacemaker or any metal in your body. So that's bad. There was a woman online who used to sell a book in which she said she could, and her name was Marie. I don't remember her last name. I think her first name was Marie. And she had advertising across the internet saying that she could cure IC if you bought the book. At least I'll come back to that, okay? And so people bought her book, and her book said reduce salt. So, that's an issue. Another kind of fad was marshmallow root. A lot of people were saying everybody should do marshmallow root without understanding that about half of the people who try marshmallow root do not do well on marshmallow root. That marshmallow root can be a little bit irritating. And I think the most important thing that you need to take away from what I'm saying to you is anybody who says every single patient has embedded infection, or every single patient has pelvic floor, or every single patient has this or that, those are the charlatans, because they are not respecting and understanding the diversity in the IC patient population. There are far too many patients whose symptoms start after injury or trauma. Now, like for example, on Friday, I was working with a woman who had been diagnosed with IC for, I think, 10 years. 10 freaking years. She'd done every bladder therapy. Nothing worked for her. Nothing worked for her. And she didn't know what to do next. So I was like, do you know about subtypes? No. So we're kind of walking through the subtypes. And I was like, well, what are your symptoms? She goes, well, I don't have frequency and I don't have urgency. I'm like, oh, interesting. Do you have pain? Not really. Do you sleep through the night? Every night. I sleep through the night. Are you diet sensitive? No, I can eat anything. Okay, when is your pain the worst? Before you pee or after you're done peeing? For her, it was after she was done peeing, not before. When you try to urinate, can you start your stream right away? No. Oh, you know where I'm going with this. Does it take 5, 10, 15, 20 seconds before you can release urine? Yes. Okay. Is sex painful? Oh my God, yes. Has it always been painful? Yes. Are you saying you have never not had painful sex? She said, no, it has always been painful. I was like, okay, do you dread going to the gynecologist because you know when they put that speculum in, it's going to hurt? She goes, yes. Oh my God, I hate doing it. Have you had a cystoscopy? Yeah. What did they find? Nothing. My bladder was healthy. What's wrong with me? My answer was, okay, well, has anybody checked your pelvic floor muscles? And she's like, not really. And I went, well, that's the missing piece, because all of your symptoms are pointing not to your bladder wall. They're pointing to your pelvic floor. I was like, so your next step, let's go see what the hell's going on with your pelvic floor. How about going and having a pelvic floor assessment? And listen, sex is painful. You can't urinate right away. And her flares were really muscle-driven flares. So anyway, anybody who says we're all the same is wrong. We have diversity. We've got Hunner's lesions. We got bladder wall driven. We got pelvic floor driven. We got pudendal neuralgia. We got central sensitization. 5 core variants. And in the bladder wall driven, we've got subvariants. We got Hunner's lesions are 1. We've got estrogen atrophy, definitely 1. We got chemocystitis. That is definitely a subtype. And there is absolutely a small population of patients who do have chronic infection. And so it's not everybody. It's a small percentage of patients. If I were to guess in the bladder wall, in the bladder wall subtype, I think maybe 20% might have chronic infection. It's just a guess on my part. And so Lisa says here, sorry to disagree, but some of us, including me, got well taking long-term antibiotics, including some people who do have embedded infections. Yes, I'm not disagreeing with you, hon. Absolutely not disagreeing with you. The question is it safe for everybody to try long-term antibiotics? And that answer, of course, is no. Hold on. Hold on. Everything okay? Everything okay? Okay. Scoot your butt back. You're going to fall off. Scoot back. You're going to fall off the bed. Okay. I'll go get Dad because I'm doing my meeting, okay? I'm going to go get Dad because I'm doing my meeting. Okay? Dad, she's up and needs your help. She was just calling help, and I got her up. What? Mom is up and now she needs your help. I know, but I've got like 30 people watching you right now. All right, sorry about that. My mom was doing her help. She's okay. She's okay. That's just what she does if she can't push herself up in bed and she needs somebody. I got her sitting, and my dad's coming back to help her. Okay. So the next question then is, how do we find that infection? And that's difficult. It's difficult for a number of reasons. There's something called a bacterial biofilm. A biofilm is a small population of multiple different types of bacteria that live underneath a waxy coating. And so bacteria flock to each other and create little tiny colonies. There's lots of different types of bacteria in this little colony. So they all huddle together and then they excrete this waxy coating. And that waxy coating is almost impossible to penetrate. Antibiotics really cannot get through that biofilm. And biofilms, once they eat the food that's within that little colony, it breaks open, and then they all swim around, and then they come back together and create a new biofilm with a new source of food. And so if we have a biofilm-driven infection, finding it is going to be a bit challenging, because the only time you're going to have bacteria floating in your urine is on those moments when the biofilm might break open. So that's one concept. Is it a biofilm-driven infection? Research has watched biofilms travel up catheters from outside of the body, up through the urethra into the body. So we know biofilms can get to the bladder. But then there's something else called an embedded infection. So what is an embedded infection? What Dr. Fugazato was saying about an embedded infection is that an embedded infection is a very low count infection. It's not a big, massive infection. It's a low count infection that's deeper into the bladder wall that's persistent. And when they do urine culture results, they count the bacteria and they say, okay, if you've got over 100,000 bacteria, then you definitely have an active infection. But what if you only have 20,000? Well, Dr. Fugazato and others would argue that 20,000 do not belong there, and those could be a source of discomfort and a source of issue also. And that's one of the debates right now in UTI care is at what point do we treat antibiotics, et cetera, et cetera. And then we have next generation DNA urine testing. And next generation DNA urine testing is going to have the most finesse at identifying little tiny infections. It's because it doesn't grow any bacteria. It literally is just going to look for DNA, and it's going to tell you everything it finds. It's going to tell you good bacteria, it's going to tell you bad bacteria, and it's going to tell you fungus. And so the next generation DNA urine test is the most specific test you can do. Will it identify a biofilm infection? If the biofilm is open, will it find an embedded infection? Hard to say. Hard to say. But the trend in all of the major urinary biome studies, where they, especially, for example, with the National Institutes of Health MAP Research Network, where they collect urine over time of hundreds of patients, right? And they just are not finding that. They're not finding a consistent bacterial pathogen as the underlying cause for IC. They did identify fungal infection in patients who are flaring. If you flare when you eat sugar, if you flare when you eat carbs, then you could have a fungal infection, right? And here's something that we've just learned about COVID, right? COVID causes immune dysregulation. So what does that mean? It means that that a major viral infection like measles or COVID literally resets your entire immune system. So all the defenses you had to other things are wiped out. They're wiped out. And your immune system now has to relearn those defenses. Measles did that back in the 60s and 70s. That's when they documented that. COVID's doing that now. And so I think we're going to see a lot more women struggling with fungal infections and bladder infections because you've lost potentially some of your innate defenses. So it's tricky. And that's why when I work with patients, we always want to kind of go back and go, okay, tell me what was going on when your symptoms began. So with the woman who has always had painful sex, who had a completely normal looking bladder, she did not have infection. Absolutely not. She had no urinary symptoms at all. She had pain. Her pain occurred after urination, but it was very connected to urination. That points to muscle. Let's see here. Chi-Chi says, oh gosh, darn it, Facebook always pushes it back as soon as you guys. I'm asking my doctor for hormones to stop the ovulation. It hurts really bad, but GI, my pain is coming from constipation. I don't think that is that. Well, topical hormones would be helpful. It would be interesting to see if a topical hormone like a hormone cream might help a little bit. But, the constipation, guys, listen, we all struggle with constipation at one point in time in our lives. We do. And for some of us, it's more persistent than others. If you have tight pelvic floor muscles, the odds are it's going to be hard for you to relax to have normal bowel movements. I'm in that case. It's frustrating to have to deal with tight pelvic floor muscles so frequently, but it is what it is. That is what happened. And also, if you're not eating enough fiber, women need to eat 20 to 25 grams of fiber. Men need to eat 25 to 30 grams of fiber with a good amount of fluid to have normal bowel movements. If you're not eating enough fiber, then you're not giving your bowel bulk. And if you're not drinking enough water, you're going to end up trying to poop out hard stones. The harder your stool, that means it's a direct reflection of how much water you're not taking. Your stool should, a perfect bowel movement should look like a snake in the toilet, right? It should be long and skinny and flexible. That's what they say. If you're passing rocks, as I am well known to do at times, then that means that you're not doing enough water and you're not doing enough fiber, which is why I always have Heather's tummy fiber in my smoothie. Mary says, how can cystitis be helped? Do you know if of medications that can help me? The doctor says there is nothing. If you have cystitis from chemotherapy, then Mesnex, MESNEX, can stop that depending upon the type of therapy you're having. Otherwise, you're going to have to buckle down and just realize that your bladder is going to be really, really, really sensitive while you're going through chemotherapy. And so you don't want to make it worse by doing coffee and soda and stuff like that. You got to really try to protect your bladder. And I've asked a number of doctors what I see patients can do, those who have to go through chemotherapy for one reason or another. And there was a strong suggestion to do Elmeron because Elmeron puts a protective coating on the bladder. Of course, Elmeron's now linked to eye issues, but if your chemotherapy is 6 weeks, that might be a reasonable risk, or you could potentially, again, maybe try some of the chondroitin-based supplements. Bladder Builder would be, I think, a really good choice because it's got chondroitin for the bladder wall, but it's got PEA for pain relief. And I think that would make recovering from chemocystitis easier. Kathleen says, I'm bladder wall driven, estrogen atrophy and retention, can urinate throughout the day and always prior to cathing. You must cath to fully empty your bladder 4 times a day. A UTI every damn month for 4 years, despite bladder installations 2 times per year for 2 years. You're on macrobid every time. So Kathleen is one of those patients who absolutely is struggling with long-term recurring infections. And we know that usually the reason why that's happening is because the patient has estrogen atrophy. The bladder lining is diminished. We don't have that nice thick coating of mucus that estrogen helps grow. As we lose the estrogen, the bladder mucosal barrier gets thinner and thinner, and it basically makes it much easier for bacteria to infect the bladder wall. What the research found is that about 24 hours before the bacteria arrived in the bladder, Kathleen, they found it in the vagina. And this was from a class I took at a National Institutes of Health meeting taught by Dr. Anthony Schaefer. And what he said is that if a woman has had 2 bladder infections in 6 months, 3 bladder infections in a year, you are considered a recurring UTI patient, and you are not a simple UTI patient, you are a complex UTI patient. And for these patients, in addition to finding the right antibiotic, they also always want to make sure that topical estrogen is being used whenever possible in the vagina to improve vaginal defenses, so the vagina does not become a safe haven for bacteria to thrive. So that would be the question that I would ask you, Kathleen, is you got estrogen atrophy. Are you using your topical estrogen? Mary says, do opioids cause bladder flare-ups? Not usually. You took tramadol yesterday and you were up all night with retention? Isn't that an interesting question? Hold on a sec.
It is Thursday.
Oh, hold on. Let's look at the side effects for tramadol. Because you could be having what is the word? An opposite. Oh, come on, it's on the tip of my tongue. Some patients have a side effect that is exactly the opposite of what the medication is intended. So if a medication is meant to make you drowsy, some people get super, super hyper on it. And that is starts with a P, paradoxical. It's a paradoxical reaction. So I have to wonder, let's just look at tramadol for a moment. Let's see. Let's go to drugs.com. Elke says she's doing 3 rounds of radiation, no chemo. Will my bladder go crazy? Elke, where are they delivering the radiation on your body? Is it in your pelvis or is it in your breast? Where are they pointing the radiation at? All right, getting back to tramadol here. Let's see. So I'm on drugs.com. Blood in the urine. Increased blood pressure. Right, great. Dark urine. Difficult urination. Yeah, there you go. Irregular heart rate, indigestion, fast heart rate, loss of memory, numbness, pain, etc. So, girl, you need to let your doctor know that tramadol is making it very, very difficult for you to urinate. That may not be the medication for you, hun. Mary said, is it the bladder builder or the bladder rest? The bladder builder is the one that has the most potential ways of helping. Kathleen says, you're not using your estrogen very often. You hate the cream dribbling out of you. Everyone said, you have just said it's exactly what each urologist said. Yeah. So do it at night, hun. I do it at night. And it gets absorbed. It doesn't drip out. Just do it. Put it in right before you go to bed. You won't even notice it. Okay. So Elke on YouTube. Elke on YouTube. Where are you having the radiation, hun? The uterine area. Full hysterectomy with 6 nodes, stage 1, grade 1. Oh, honey. Big, giant hug to you. The oxycodone helps you urgency for about 4 hours. Well, radiation cystitis is real. I'm not going to hide it from you. I think it's important that you understand it so that you can talk to your doctor about it. So when somebody has radiation, especially for men who are having radiation for prostate cancer, it has the potential of irritating blood vessels. And so that radiation cystitis is often being driven by irritated, inflamed blood vessels. So their ability to target the radiation correctly is going to be the most important here. Normally, when you have radiation therapy, they basically create a guide, which is kind of a map on your body that they put on you that tells them exactly where they need to focus that radiation. And so the goal here is to get them to focus the radiation away from your bladder at all possible. Now, number one, you're not alone, girl. I had a hysterectomy for uterine cancer too, and I just it hadn't gotten to the point where I needed radiation. So I understand your fear. I understand your anxiety. I understand your trauma. It's like somebody has blindfolded you and thrown you in a car and you have no idea who's driving or where the hell you're going, right? It is surreal to be facing any cancer diagnosis. And then when you get the cancer diagnosis, they don't give you the support you need because it's just shocking to your system. It's shocking, especially before Christmas. Like, oh, dear gods. So understand that many millions of men and women have had radiation in their pelvis over the years. Okay. It is as safe as they can make it. They have the skills to target that radiation much more effectively now than they did 20 years ago. And we understand a lot more about radiation. You're going to have to be super, super careful with your bladder while you're doing that. You got to understand your bladder is your weak link. And so no coffee, no green tea, no black tea, no soda, nothing like that. You got to do everything you can to protect that tissue so that if by chance it is irritated by the radiation, you're not going to get in a way of healing. Because once you're over and done with this, healing will happen. Healing always is happening. That never gets turned off. So once you plow through that radiation, get out on the other side, you'll be able to take a nice deep breath and just really give those tissues an opportunity to calm down, okay, and to start that healing process. Mesnex is for chemotherapy. There are some forms of chemo where the chemotherapeutic agent, when it's metabolized, produces this very, 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 very irritating byproduct that burns the hell out of the bladder. But Mesnex, if you take Mesnex with the chemo, it breaks it down so it cannot irritate the bladder. So that's only for chemotherapy. And should you ask about estrogen, I think you're going to need to have a good, hard discussion with them about what you're going to be able to do. You're actively cancerous right now. So I don't know anybody who would tell you to use estrogen right now. You got to get through that entire process now. Let's just big deep breath, step back, have faith in your body, have faith in nature, have faith in your faith. I love my favorite affirmation. I can do all things through my faith, which strengthens me. Insert whatever faith you have. Or be bold and mighty forces shall come to thy aid. You can do this. You will do this. You will get out the other side. You've already come this far. You've already had the hysterectomy, and that's the hard part. Right, Elke? That's the hard part. That's a really hard part. All right. Yep. Kathleen said she was concerned about strokes from the estrogen 1 gram. I'm 72. Kathleen, I would encourage you to Google topical estrogen safety, because estrogen cream is far more safe than oral medication. If you were taking oral estrogen, that absolutely is associated with far more side effects, because that estrogen is circulated throughout the body, because it's absorbed through your stomach and goes into your bloodstream. It goes everywhere. And that's why oral estrogen has such a strong association with other cancers. But topical estrogen, it stays in the skin and is not distributed to any great degree throughout the rest of the body. But don't believe me, you need to look at the research yourself and see how comfortable you are with that. So again, topical estrogen safety. Mary says, I wonder if having too many CAT scans or x-rays can cause radiation cystitis. That just occurred to me. I've had 3 CAT scans on my jaw in a year, and honestly, I'm having exactly the same worry. I can remember when I was in 7th grade, they did a myelogram and they injected a radioactive tracer in my blood, into my blood. And it's like, great, I'm now radioactive for the rest of my life. And that, as a teenager, I knew that was bad, right? Mary says, can Mesnex be given after chemo? It's meant to be used during chemo, because it breaks down the byproduct. It's not going to be effective after you're done with chemo. So Kathleen goes, correction, she did the bladder instills 2 times per week for 2 years, then occasionally bladder installations for 6 weeks. Sick of everything. You've been through 3 urologists in the last 2 years. Only thing left is a trial InterStim after Christmas. Well, hold on a sec. I got to scroll back and look at what you wrote. I mean, I don't know, you know, honey, InterStim is not going to do anything for estrogen atrophy, and it's not. And if so, it's very important that you differentiate between cause and effect, right? You can chase the symptoms forever doing lots of different medications, but we don't want to do that. We want to understand the underlying cause and fix the darn thing so you don't have problems in the first place. So in your case, you are driven by estrogen atrophy. You are bladder wall driven estrogen atrophy. And so InterStim isn't going to fix estrogen atrophy. What's going to fix estrogen atrophy is topical estrogen. What's going to protect the bladder wall because of estrogen atrophy is either going to be Elmeron, which we're not doing, or chondroitin. And so I would be focusing my time and effort on trying to help repair the bladder wall. InterStim is surgery. It's at least 1, if not 2, if not 3 surgeries. There are thousands of adverse events reported to the FDA in the MAUDE database with InterStim. It is not a piece of cake. Patients are getting deep tissue MRSA infection. And so before you did InterStim, why not consider doing the ankle stimulation first? There are 2 different forms of neuromodulation out there that are both approved for overactive bladder and incontinence. None are approved for IC, but they're often used for IC. So you've got urgent PC, which uses an acupuncture needle at the ankle, and it attaches a TENS unit to it, and it happens to re-regulate and kind of normalize the nerve as it goes back up into the pelvis. Or you've got InterStim, which targets the same nerve, but it targets it up by the sacrum, by the tailbone, and it requires surgery. And of course, anytime you have surgery, you're running the risk of adverse events. But one of the biggest concerns about InterStim is just long-term maintenance, because you have metal in your body. And if you get in a car accident, will you be able to have an MRI? Maybe not, although the new devices are supposed to be MRI safe. It would be very important to look through the FDA database and look at, so that you have a very clear idea of what is being reported every single day with patients who are having complications from InterStim. In contrast, the ankle stim is super easy. It's super affordable, doesn't require any surgery, and is a more logical first step when you're going into that neuromodulation group. And I know this from personal experience because I live in Northern California, and I was referred to UC San Francisco in 1993 when InterStim was invented at UC San Francisco. So I was referred down to UC San Francisco for IC care, but the blessing is I didn't end up in the InterStim group. I was in the ankle stim group. And the ankle stim, and I would have done InterStim back then. I was desperate. I would have done anything. I begged them to take my bladder out, and they said, no, we haven't done anything yet. We're not going to take your bladder out. Praise God, hallelujah, that I didn't push that, because I'm symptom-free now the great majority of the time. But the guy who invented the ankle stimulation, Marshall Stoller, was appalled by all the side effects of InterStim. And so I have tattoos. Let me see if I can contort myself to show you. All right. Can you see this little black dot right there? There's a little black dot right there. That's where they put the needle. So it is 3 finger widths from the top of the ankle bone right here. You see that? And then it's about 1 finger width from the bone right here to get it exactly in the right spot. So over on the IC Network website, I have a whole section on neuromodulation. And I would encourage you to go look at that first. Over in the IC Network forum, I have 4 forums dedicated to neuromodulation. I've got considering it, trying it for patients in trials, failures, and successes. Because you got to have your eyes wide open with InterStim. This is not an easy thing to do. It's going to require constant maintenance. So one thing you want to ask your doctor is, if I lose my health insurance, will you continue to care for my InterStim? And if they say no, then that's a good reason perhaps not to do it. There has to be a plan so that if something changes, you can still get care for that metal in your body, that medical device in your body. And then the other thing that's really, really even more important is you need to make sure that it is covered by your insurance, and you have to get it in writing ahead of time. We had a nurse who had it done. She didn't want to have it done, but all the urologists in her, she had 3 urologists in town. They all told her her only option was InterStim. She felt pressured into doing it, but she, you know, they wanted her to do it. So she decided to do it. She was a nurse, so she was pretty savvy about insurance, right? So she asked the billing staffer in a doctor's office if this was covered by insurance. They said yes. She called the hospital where she worked, where she was having it done, and talked to their billing office and said, is this covered by my insurance? They went, absolutely. No written pre-authorization is required. She then called the insurance company herself and said, is this covered by my plan? They said, absolutely no written pre-authorization required. So she did it. A week later, she had a threat to garnish her wages, and they were charging her $80,000. They denied it. So do not have InterStim done until you have written confirmation from the insurance company that it is covered. That was the painful lesson that she taught us all. Curtis says, is it okay to take bladder rest with Peora? Yeah, absolutely. They're actually meant to work together. And also a multivitamin. You got to be careful with the multivitamins, Centrums and One-A-Days. Any vitamin derived of ascorbic acid as a source of vitamin C is going to bother your bladder most likely. So you're going to want to do a low acid multivitamin like Bladder Smart. Bladder Smart is the low acid vitamin that we have. It's the one that I take, and we should have it soon. We haven't had it for 6 weeks. Big manufacturing delay, but I think they made it last week, and now they're doing another round of testing. You know, with supplements, there are 2 ways that you can test it. You test the ingredients for quality before you make whatever product you're making. And then once it's made, you send it out for testing again. And so all of the natural approach nutrition supplements that we sell have a lot of testing behind them. Or they might have been waiting for one ingredient. That might have been delayed too. Stacy says, I can only go off my experience, but I think there can be a lot of variables for IC. My IC manifested after surgery, but not everyone knows the cause. Absolutely true. Absolutely true. For some of you, it was something that happened in childhood. You might have had a trauma in childhood. I was watching a TikTok last night, and, you know, like, I don't know where the hell to go on the internet now. I'm sorry for swearing. I don't really know of a safe place to go and just kind of and relax, right? TikTok was a great place for me to just relax. And there are some really, really good things on TikTok, really good therapists, physical therapists, psychologists, doctors, nurses. But, you know, TikTok is a Chinese intelligence weapon. There's no doubt about that too. So, and Twitter was my other favorite place, but Elon Musk has destroyed that platform pretty much. So anyway, there was a psychiatrist who's specializing. Oh, he was talking about Celine Dion's diagnosis of stiff body syndrome. So stiff body syndrome, and I actually had a lady in my original IC Redwood Empire support group who also had stiff body syndrome. And I can remember her walking into one of our meetings and she was like a robot, you know, she was very, very stiff. And I gave her a hug and she whispered in my ear, she said, "I pray you never, ever get this." And it's where the nervous system is so greatly compromised by stress or trauma that, and he had some very, very specific language that if you are enduring high stress for very, very long periods of time, that can be a contributing factor to anxiety, depression, chronic overlapping pain conditions, and stiff body syndrome. And that, of course, made me wonder what Celine Dion's stresses, you know, have been, but we kind of know what they were. She's had a tough life. Stacy says, "I totally understand that. It's sad how media has evolved into what it has become today." Yeah, I mean, it's not a safe place anymore. I hope this is a safe place. You're really not going to hear me being mean to anybody. At least I pray to God I never appear to be mean or insulting to anybody. I want this to be a safe place where any IC patient can come and ask questions. I don't ask your party. I don't ask your religion. I don't ask anything like that. If you have issues, I want to try to help or give you better questions to take back to your doctor. All right, hold on a sec. Wynn says, "Diagnosed with bladder wall subtype from symptoms and bladder inflammation on cystoscopy, have been on strict elimination diet for several months. You're better, but still in pain. Is it possible to never get full pain relief, just improvement, and have to live with a certain amount of pain? Trying to figure out when or if to reintroduce foods. You have a pelvic floor physical therapy in 2 weeks. Estrogen is good, postmenopausal, hysterectomy, but you're using HRT depot injections. You just had your levels tested." When, again, we have the chicken versus the egg. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? For some of you, this begins directly with a bladder wall dysfunction or trauma of some type, while for others, it begins with a muscle subtype. So again, if you've got a really, really bad infection, or you've had cystitis, or you just have had a terrible, terrible diet for years and drinking energy drinks every day, your bladder is going to be injured. And when it's injured, it starts to hurt. And because it's hurting, your muscles will get tight to protect you. And so our therapeutic priority for that bladder wall patient is to find the irritant, eliminate the irritant, and create an environment that will support healing. And if your bladder wall symptoms are being driven by estrogen atrophy, then we certainly want to make sure we're treating the estrogen atrophy correctly. But again, understand that your muscles are still involved. 85% of IC patients have tight pelvic floor muscles. So when we think of our subtypes, our biggest subtype is pelvic floor. It is pelvic floor by far. So the question then is, can the pelvic floor influence how the bladder behaves? That's called the somatovisceral reflex. And the answer is, it can. It can. That if your muscles are tight, they are going to restrict blood supply. If your bladder is supposed to get 24 units of blood a day and it's only getting 10 because your muscles are so tight, will you have a healthy bladder wall? No. And because your blood flow is so diminished, the nerves start to become inflamed also, because nerves need good blood supply to function. And so that long-term muscle tension will absolutely cause the bladder wall to become inflamed and perhaps to start breaking down. So the pelvic floor physical therapy appointment for you in 2 weeks is really, really important, especially given the fact that you've had a hysterectomy, because hysterectomy is also known for causing and damaging muscles and causing more pelvic floor tension. So I hope you'll come back and let us know what they find with your pelvic floor assessment. And you haven't talked about therapies either. What therapies have you done to try to calm your bladder wall down? So in the AUA guidelines, the treatments used to be arranged with respect to the risk of adverse events. So they want you to do the easy stuff before you do the hard stuff. They want you to do diet modification, muscle relaxation, stress management, and supplements before you start the harder medications that have a lot more side effects, like the Elavils and the antihistamines. And so, I mean, what other therapies have you done that might help try to reduce some of this pain and discomfort? Angel said 4 weeks post cystoscopy, ovary tube removal. This week you'll have pelvic floor physical therapy. Is that too soon? Well, with hysterectomy, is it 4 months or 6 months? I don't know, Angel. It sounds a little early, but I mean, the cystoscopy is not going to play a role in whether you can or cannot have pelvic floor physical therapy. The far more important question is, you had your fallopian tubes removed. So how did they do that? Did they do that through your cervix? Did they do that through your vagina? Or did they do that through your abdominal wall? Those are going to be the ones that are going to prevent you and be far more sensitive for you to have pelvic floor therapy. So I would, as Stacy said, I think you need to call your gynecologist and ask what they believe that would be. I think 4 weeks could be too soon. I waited 10 months after my hysterectomy. I would have punched somebody in the first 6 months who tried to do a pelvic exam on me. Okay, so you had a laparoscopy. Well, I don't know, hon. You're going to have to ask your doctor. I just don't know. Hi, Les. How are you, hon? All right, let's come back here and let me get a drink of water. So this is my breakfast and lunch. Let's see how we're doing from a dehydration standpoint. Nope. Good on this one, slow on this one. I probably need to do one more of these to get properly hydrated. Wynn can't hear me. Okay, sound is back. Good. Mary says, can they tell on cystoscopy that estrogen atrophy is causing your pain? I've treated atrophy with E-string and bladder. Still very angry. Not sure what to think. They can tell the estrogen atrophy from a vaginal exam, because skin that has estrogen atrophy, it has a different appearance. It has lines in it that healthy skin does not have. So if you got atrophy in your vagina, you definitely have atrophy in your urethra and in your bladder. It's useful to, I mean, I don't like guessing. I like facts. And if you've been in pain for a long period of time, I think that's justification for having a cystoscopy, to let somebody take a look and see if anything funky is going on in there. I would want to know. And even doing a biopsy, maybe. I mean, they only do biopsies for patients with Hunner's lesions, though. So Gay says she had the axonics implant. Kathleen says, I want to find a urologist who would do the ankle stim in Georgia. I remember you mentioning this a year ago. I have not wanted to do the interstim when it was mentioned to me 4 years ago in Colorado. Yeah, and in Colorado had a whole bunch of federal lawsuits about interstim years ago. So I understand that issue in Colorado. If you go to, let's go to their website, which was urgent Hold on. Can I type today? Apparently I cannot type today. virginpc.com. Nope. Okay, hold on. It was owned originally by Uroplasty, but now they changed the name of the company, or they were acquired. It's now by Labori, L-A-B-O-R-I-E, Labori.com. Normally they have, okay, hold on. They would have yeah, they do. They have a find a provider database right on their website. So let's do urology and let's do Georgia. What is the, hold on. What is the zip code for Atlanta? Okay, 30033. Let's see if that comes up with anything. Well, that's a hard no. Honey, I would call Labori, L-A-B-O-R-I-E. Call them and tell them where you are and say you would like to find a provider that can treat you. Okay. Now, the other question is, do they have a contact us on their page? Yeah, they do. They've got their phone number, 800 number. They also have an email. So call them tomorrow. Okay. Stacy says, how does that work? Testing it out that way. What do you mean? Testing what out? Danielle says, this is a safe, caring place. Thank you. I try, and I really try. Man, we had some very painful moments in the early IC movement on the internet. And, you know, everybody, listen, we all have to have very thick skins now. You know, very, very thick skins. Listen, I had critics from the day I started the IC network. They were not nice. They were pretty mean. I mean, I had somebody saying you're profiting off of patients. And I was like, how? It's free. Everything is free. That's right. These meetings are free. Our website's free. Everything is free. The only thing that's not free is if you want to buy a book or something, which is reasonable because we have to make a living. But anyway, you have to have a really thick skin and don't give people you don't know the power to hurt your feelings, because too many people out there are getting joy in being mean. It's really bringing out very terrible psychologies. And do not stay in a group that's being mean. You deserve better than that. Walk out. You don't need that. You don't need that in your life. We need a good, encouraging atmosphere. We don't need places where people hurt each other deliberately. Georgia says, I have tailbone pain in part. Is tailbone is part of IC or bowel straining. I did some physical therapy for a month. I didn't do the exercises, and I'm in terrible pain 24 hours. Do you have any advice? Ice or hot? Let me get my model here. Hold on a sec. Whoop. Hold on. All right. So let us ponder for a moment. Ponder for a moment the tailbone. So look, here's the front of your pelvis, your hip bones, your pubic bone, right? These are bones that are connected right here. But let us look at the rear. So here we have vertebrae. Then we have the triangular sacrum. And down at the bottom, oh, the mighty tailbone, right there, the tailbone. And I want you to look at everything that attaches to the tailbone. The tailbone is a dynamic force in the pelvis. The tailbone helps you balance. It helps you control your body in different ways, whether you're squatting down, bending over. There's always going to be a little bit of subtle movement in this pelvis that's trying to keep you upright. And you can see, again, the muscles and everything that attach to the tailbone. So tailbone injuries are common in patients with pelvic floor issues. Common. And so here we have muscles that are strained and stressed, and then, God forbid, you start squeezing them to have bowel movements, you're going to reinforce hypertonicity. You're going to reinforce muscle tension. So you need to go back to physical therapy, hon, because the tailbone pain's actually probably coming from one of these muscles here. And you say you didn't do your exercises, and that's what we got to do. I have the same thing. If I don't do my exercises, my muscle issues come right back. Ice or hot? Ice for nerve pain, heat for muscle pain. And I use Tiger Balm. I love putting I get pain around my left sit bone. And I just swab that area with Tiger Balm. And that seems to work pretty well. Kathleen says, what kind of fiber do I recommend? Heather's tummy fiber, which is acacia fiber, which is, where is it? Oh, here it is. My office is a small, confined space. Right, Heather's tummy fiber. Love, 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 love this stuff. You know, if I could not do psyllium husk or Metamucil. Psyllium husk is half soluble, half insoluble fiber. This is all soluble fiber. This is perfect. It's created specifically for people who are sensitive, who have IBS. So this is our go-to. Mary said, I had 3 cystoscopies. I just don't understand what's going on. They originally thought atrophy, but the E-string is helping the vagina, but that was never my issue. It's always my bladder. So I wonder now if it's a red herring and not atrophy at all that's causing your pain. They seem to have no idea your pain is bad. So, Mary, tell us more about the pain then. Is it, let me ask you a couple questions about your pain. Where is it? Is it on the left side or the right side or centered? Is it low or is it shallow or deep? Do you have pain and any pain on your skin on the outside, or is the pain all on the inside? And what makes the pain worse and what makes the pain better? Thank you, Danielle. Thank you. We do try. Elke says, I live across the river from New York City, best hospital doctors. Why can't I find a real IC expert? It's all surgery, sales, and no solutions. Elke, Robert Moldwin is out on Long Island. He is one of the top doctors in the world. He is the author of an old IC book called the IC Survival Guide that's outdated now. But he and his wife, Jen, are fabulous. And they run the Pelvic Pain Center at Long Island University. That's where I would go. You also have David Kaufman in New York City, but I think he's retired now. I'm not sure. But Rob Moldwin, you know, he's just the cat's meow, for lack of a better term. It's all surgery, sales, and no solutions. Well, I mean, that's the thing, is that we have to focus. That's why when you go to a new doctor, do not walk in and say, you got IC. For God's sake, don't do that, because you'll fall down the rabbit hole of whatever they believe about IC. You need to walk in and describe your symptoms. You need somebody to study your body. And if bladder therapies aren't working, there's usually an important reason why, and it's usually beyond the bladder. So we want to make sure, number one, is there endometriosis attached to the bladder? Is there fibroid tumors pushing on the bladder? Is there pelvic congestion syndrome, a problem with blood vessels? Is there a long-term problem with muscles, right? Elke says, what do you do your hairs with? Huh? I don't understand the reference to Swedish crisps. What do I just put this in a smoothie or in a cup of hot water. Where do I get the Tiger Balm? The IC Network has it. It's in every grocery store, pretty much, but we have it too if you want it. And you guys, when you buy from the IC Network, I understand that, you know, Amazon's very easy. I go to Amazon too, but when you buy from us, you really help. You really help me continue this work. And this has been a tough year. Elke says, Long Island is too far. Oh, come on, hun. You have one of the best doctors in the world. What is it, an hour away? He's worth driving an hour to even once to just get a second opinion, right? You know, I can remember when I was referred to UC San Francisco, it was 80 miles away. And I was like, I'll never get there. Driving was so painful. It was like, oh my God, how do you even think I can get there? And I did. I went 12 times. And the first thing that Dr. Stoller said to me, my very first appointment when I walked into his office, he said, you're in agony right now, aren't you? And I just burst into tears and started sobbing. And it's like, he was the first doctor who saw that I was in pain. It was worth driving that far to have a doctor believe me. And Dr. Muldoon believes you. He would. So I don't want to say if I can do it, you can do it. I'm just saying that it's worth it. Don't create obstacles in your mind that you can't do it. He could change your life. He could figure things out for you. And that might be worth an uncomfortable drive just to get there. Even if it's just you're homebound, no car with cancer. Oh, honey. Oh, boy. I'm so sorry. Well, the other thing too is you could actually potentially even talk with him by phone, right? And you might be able to do a virtual meet. A lot of doctors are doing that now. And so even if you could just have a video conference with him as your first appointment, that would go a long way. And because you'll be able to present your symptoms and get some good insight. And of course, he's going to say, it's no substitute for you being in here, but let's see if we can help a little bit, right? Especially now. Kathleen says, thank you again, Jill. I'm a pebble pooper and we're still collect suppositories at least once a week. Girl, I feel you. I have no shame. I'll talk about anything. I mean, don't you just wish? I mean, I would just love to be able to have that perfect bowel movement every morning and you're just done. That's like you can go work out, you can go do the job you need to do. It's like life is good, right? Those are elusive, at least for me. Not this morning, though. This morning was a good morning. Not that you needed to know that. Sorry. Okay, Mary says her pain is definitely over the bladder. Feels like a UTI. Okay. So getting back to Mary and trying to understand Mary's pain. It's centered over the bladder, feels like a UTI with frequency, burning, pressure at varying degrees. Pre-leaf helps the burning. Okay, so that points us to your bladder wall. Advil helps the pain in large doses. You had Microgen and Cirrus. They're both negative now. You were on antibiotics for 1.5 years after the first Microgen test. So I would want to know, number one, is there any chance you have a fungal infection now from all the antibiotics? But the Microgen test would have identified that. But if you're having any other symptoms of fungal infection, feeling like you have a yeast infection, it would be worth getting another Microgen just to rule that in or rule that out, because we know that fungal infections in the bladder are beasts, speaking from personal experience. Can you take us back to when your symptoms began? You know, actually, you know what I could do? If you're interested, I could set up a Zoom if you want, and we could talk that way. And it's nice for people to kind of hear that process. So when I'm working with patients doing, no, you don't need to go out of the country. No, for God's sake, no, woman, no. There's no reason for you to go out of the country. The United States is leading the IC movement at this point in time. But we've got to get you to a doctor who will do a proper pelvic pain workup for you. So and there's a book you really need to, here, hold on. Where is it? Here it is. Okay. Okay. So you are, Mary, you are an anatomical mystery to be solved. And what we know about pelvic pain is that nothing operates in isolation in the pelvis. Everything can influence everything. So your uterus can influence your bladder, your vagina can influence your bladder. Your bladder can influence other things. Muscles are playing strong roles. Nerves are playing strong roles. It's all a jumble. But you have to kind of get out of your head that you have a bladder disease. Think of this more as a pelvic pain syndrome, because we have to look beyond also. Now, for patients who are not responding to treatment, and your doctors are just baffled, it's like, we don't know what the hell's wrong with you. Why? We don't know what to do with you next. And you sincerely want to get better. You're sick of living like this. You have to be the detective. And when I'm working with patients on the phone, I always go back to when your symptoms began, because patients miss important things. Like, have you been in any accidents? Have you had any traumas? Anything at all like that is so important. Were you an athlete? Anything at all like that. Because they have to understand context here, because sometimes it really is a trauma that begins this entire process. The other thing I want to know, Mary, is do you have any other pain-related conditions? IBS, vulvodynia, TMJ, fibromyalgia. Okay, so anyway, this book, Facing Pelvic Pain. Girl, you need to read this book. Because if any book is going to solve this mystery, it is this book. Because it is made by Harvard, the Mass General, edited by Dr. Elise Day and Dr. Thomas Stern. And Elise Day is one of the new young guns in the IC and pelvic pain world. And I was very honored that they asked me to contribute to this book also. I wrote a chapter in this book also. But anyway, what's so cool about this book is that every chapter is devoted to different structures that can cause pelvic pain. And so, which gynecologic conditions can lead to pelvic pain, chapter 3. And you need to read all of this. Which urogenital problems can lead to pelvic pain, your urethra, your bladder. Like, one of the things that sometimes happens is something called a urethral caruncle. You know what a urethral caruncle is? It is a prolapse of the urethra, that you're straining so hard to pee that you literally push out part of your urethra and it becomes like this little fleshy mass or flower at the entrance to your urethra. Fascinating. Which GI problems can lead to pelvic pain? Which musculoskeletal problem? That's going to be very important for you. We want to make sure there's nothing going on with your muscles or your bones. What type of bone and ligament problems can lead to pelvic pain? What neurological problems can lead to pelvic pain? Chapter 10, what are rheumatologic, neuroinflammatory, and vascular pain? How to physical therapy, diet, exercise, etc., etc. I think you need to take a step back, step off the IC pathway for a moment, and just read about these other potential causes and ask yourself if you're having any of these other symptoms. And the devil is in the details here. That what inevitably confirms the diagnosis is that one weird random symptom that you don't tell anybody about. You know, that happens, you know, it's this rare, weird, unusual symptom. You get pain and tingling in your feet. You get persistent genital arousal disorder where you feel a painful arousal sensation, or you have pain when you sit down that goes away when you stand up, or you have pins and needles or areas of numbness, right? So when you go to a new doctor, you have to give them a roadmap, and the roadmap that they're going to follow is what you tell them. So you can't walk in and say, I'm fine. You can't walk in and say, I have IC. That's not useful at all. What you have to walk in and say is, okay, I haven't slept through the night in 20 years. I get up at least twice a night. I struggle with constipation. I have moments when I can't start my urine stream. I have moments when my urine stream is very weak. I have pain that gets worse as my bladder fills with urine. Or strangely, I'm afraid to pee because the worst pain is going to happen as I'm peeing. Those are all very different, distinct symptoms that will lead that doctor in a very different direction. Elkie says, what time of day do I take phone calls? I'm in New Jersey. In the afternoons, usually. 3 p.m. your time, 4 p.m. your time, and on and up. I'm booked in the morning. I'm so busy. So I do all my elder care in the morning. And honestly, I'm cleaning the kitchen at 1 or 2 in the morning and washing the kitchen floor. And then that's what happens when you care for elderly patients like I do. I'm holding on by a thread, but I am holding on. Mary, you're not in the U.S. Well, okay, Mary, where are you? Danielle's from Ireland, and yeah, okay. Sherry says, I was also a pebble pooper due to hydrocodone. God, you know what? We should build a website, pebblepoopers.com. Oh, I got to see if that's available. I could build a website on that. I have a bunch of domain names. I own like 150 domain names. It's just what I collect are domain names. Okay. I want you guys. Okay, I got to tell you something. Yes, Elkie, my dad got a lot of cards, and we're still getting cards, which is so cool. Thank you so much. So, one of the websites I built years ago is whensexhurts.com and .org because I was trying to build a community for men and women who were struggling with painful intimacy. I mean, my intentions were perfectly honorable until the Russian porn people found it, right? And they swamped our support forum, and we had to shut it down, right? And so whensexhurts.com is now just books. You can go over and look at it if you want. Then this very famous mega millionaire doctor, I'm pretty sure mega millionaire doctor who's involved in TV and all sorts of stuff, called me and he wanted that domain name. And he asked if I would give it to him. And I was like, no, I'm not going to give it to you, but you can buy it from me. And he's like, yeah, but I'll do a lot of good with it. You should just give it to me. And I'm like, no, I barely have a retirement. You are super wealthy. You can afford to pay whatever for the domain name. And he refused. Like, I'm like, come on, for God's sake, people. Jason, is a book relevant for males? Absolutely. There's a whole chapter on here. Hold on. Which male urological problems can lead to pelvic pain? Which urogenital problems can lead to pelvic pain in any gender? What musculoskeletal problems can lead to pelvic pain? No, Jason, this is good, but I still think the best book we have is this book. I mean, aside from the book I wrote, IC 101, it's not just a bladder disease. I mean, that's a great book. That's really good for somebody who's newly diagnosed, who doesn't know about subtyping and all that sort of stuff. But if you're a pelvic floor patient, this is the bomb. This is the best book ever written, in my opinion. I love it, love it, love it, love it, love it. Every time I read it, I learn more. And this is the book that's just really helpful for so many, especially for those for guys who have had injuries when they were younger. And the diagrams are for men and women. It's written completely for both sexes. You can't go wrong with this book. This is the book if they just can't figure it out and you're trying to rule out other stuff. This is a great book too. All right. But for anybody with a very clear muscle issue, this is the bomb. Mary says she can't Zoom at the moment, in a bad state. Mary, you should have seen me when I woke up this morning. Makeup. Oh, dear God. You did have a difficult childbirth followed by menopause at 42. So they all thought GSM. I don't have a urethral I do have central sensitivity, but not sure which came first. Do you know about Dr. Evans? Dr. Evans in North Carolina is the top doctor in the United States. He has been voted the top doctor in the United States every single year we've had a vote. He outvotes every other doctor 10-1. He is a lovely man. He is a master surgeon. He does their bladder transplant surgeries. But his entire career has been devoted to IC in men and women. And he's kind of a big guy with a soft voice. He's just a sweetie pie. So the great majority of patients who go see Robert Evans just love him. And our goal here is to get a proper diagnostic workup. And that national doctor who has seen thousands of patients is going to be the most able to make a really thorough diagnostic workup. And so there are 3 that are kind of top tier. There are more, but the ones that Robert Evans, Robert Moldwin, and Ken Peters in Michigan, those are kind of the gold standard national expert. There are others too. Robin says, is there a discount code for the book on Amazon? No, but if you come to the IC Network, it's $6 cheaper on the IC Network website, Robin. So Amazon has a book for $35. We have the book for $29. And I think the wholesale price is like over $20. So Mary's in Canada. All right, Mary. So here's the deal. We were talking about this yesterday in the international meeting. There has, to our knowledge, never been a course on IC in Canada for urologists. I do not believe there has ever been a class. When I've looked at the Canadian Urology Association annual meeting agendas, now they might have, but Canada is, your resources are slim to none. You've got your top IC doctor, Curtis Nickel, is retired. He's in Kingston, Ontario. There is another doctor in Ontario, a woman who is very good. She has retired. I don't know if Richard Henry is still practicing. He was pretty good. He's the guy who invented the rescue installation. And so most patients from Canada come down to the United States. And if you're in the Ontario area, it's to Ken Peters at Beaumont. They see a lot of Canadians who come down for care. I was working with a Canadian patient like 2 months ago, and her first appointment with her urologist was scheduled over a year out. And she's actively symptomatic, and they expected her to wait a year before she could actually see a urologist. And then the question is will the urologist be able to help? And the answer is, well, it's pretty challenging. Danielle says, I want to join your Pebble Pooper, Pebble Pooper website. I'll think about it. Oh, by the way, whoa. By the way, something very exciting did happen yesterday. Hold on. Let me get my notes. Okay, where are my notes? Hold on. I did it on this computer. Yeah, here it is. We can now get on Amazon that okay, so this is like really exciting. So, one of the problems with having bladder installations is that you have to put a catheter up there, and that's not fun. I mean, it's challenging to those tissues, to the urethra, etc. So a doctor in Hungary created this very innovative new device. It's called a urodapter, and it's like this big. And it takes the place of a catheter. So you attach the medicine to one side, and there's like a little spout that goes into the urethra, but it barely goes in there. And you can shoot the medication right up into your bladder with this urodapter. And it's like really cheap. So for anybody who's having installations, you know what you should do is here, hold on, let me go to it. The name of the doctor who invented it was Sander Lavaz. And, oh, look at this, $39. $39 for 5. $39 for 5 of these. This is going to revolutionize home installations. And it's fulfilled by Amazon. And you know what? I'm going to buy them right now. Hold on. I want to get these in and demo them for you. And so hold on a sec. Darn it. They want two-factor authentication. I'll have to do it on my other computer later. Okay, urodapter. So for anybody who's doing self-cathing and you hate the catheter, urodapter. Jason said, I'm at my wit's end. Had you had UroLift because they assumed prostate issues. Oh, boy. Renee says she loves our book, IC 101. Thank you. Yeah, hey, man, we were predictive because we said IC is not a bladder disease 2 years before AUA said it. Jane, thank you so much for the 100 stars. For anybody who likes these meetings, make sure you follow our page for YouTube. You guys follow our page, subscribe to our page, and then you'll be notified when I go live, because I'm going to be changing things up in 23 and doing more differently. Well, just wait and see. Elizabeth says, I'm having problems getting an appointment with the urologist in the Seattle area. I finally got an appointment with the urology office, but it's with a PA. Any suggestions? So listen, hey, Elizabeth, we were talking about this again yesterday in the international meeting. It's actually the PAs that are leading IC care now. So don't assume that you're going to get bad care because it's a PA or a nurse practitioner. Actually, it is at that level that patients are now getting the best and most responsive care. University of Washington in Seattle has some IC research studies that they've done, so you could check them. We have a database on our website. But don't disregard the PA. And remember, if your case is complex, the doctors are right there. The PA can walk out the room, go get the doctor, bring him back in. It's for those of you who are trying to get into a doctor fairly quickly, get the first appointment you can, even if it's with a PA or nurse practitioner, because the doctor is there. The goal is to get you in the door. Kathleen said, I moved here to Georgia from Colorado in 2020. 4 months here, my Jeep was totaled by a kid. Otherwise, I would have driven to see Dr. Evans to see what he could do to help me. In my opinion, there is no IC specialist in the Atlanta area. You've been through 3 groups. Have you been to, there is one, Denise Pecht, Pecht. Have you seen her, Denise Pecht? She's outside of Atlanta. I've talked with her on the phone several times. She's a sweetie. She's in Lawrenceville, Georgia, at Gwinnett's Progressive Healthcare for Women, Dr. Denise Pecht, Pecht. She's interested. She's humble. She's learning. She would be a good resource for you to go to, Kathleen, and tell her Jill Osborne said hi if you see her. Mary said, there's no class, not surprised. Problem is it's so costly to go to the US for treatment. I'm not surprised about the wait times and pain here. It's horrible. Yeah, but the thing is doctors like Ken Peters, they're used to having foreign patients come down, and so they have relationships with local hotels. And so you could come down for a couple of days, be seen a couple of days in a row, and they do everything they can to make it affordable. And again, they will also potentially talk to you by phone. So the Canadian IC Society shut down. So we do not have a national IC group. There is a group on Facebook of Canadian IC patients. Run by, is it Michelle? Well, anyway, check Facebook, Canada IC. Jane says, does Sjogren's tie in with IC, just diagnosed Friday? Yes. And as we ponder our subtyping, those 5 core variants, as Dr. Chris Payne wrote when he proposed that, he said there are other subtypes we have yet to define. One of those subtypes that is probably a very, 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 very small subtype is the autoimmune subtype. And that's the link between Sjogren's and lupus and IC. What our previous data has shown is it's a very small correlation. Only like 3% of the entire IC patient community have other autoimmune diseases. But I do believe that it's its own unique subtype. If you donate stars, we get, I think, 10 cents for 10 stars, something like that. It's every little penny counts. Every little penny counts, though. So I'm not gonna turn it away. But if you really want to support the IC Network, come on over to our website and become a member so that you can get our magazine, the IC Optimist. That's what really helps us too. The more, the merrier, my friends. The more, the merrier. Kathleen said, you had to have all my installations at the doctor's office in Colorado and Georgia. The doctor would not allow me administered at home. Okay, so if you buy, honestly, guys, listen, we are the educators now. We are the ambassadors now. We are. Your doctor can only go to one conference a year, and with COVID, they're barely going to conferences now because every conference they go to is a COVID hellhole, right? It's ironic. Like if you follow doctors like I do, you'd be shocked at the number of, they started doing conferences in the last year. Everybody's coming back with COVID. It's still not the right time to go to a big conference like that. But even pre-COVID, they still could only go to maybe one conference a year. The odds of them taking a class on IC are slim. So we have to be the educators. That's why I encourage you to print out the new AUA guidelines and bring a copy of that to your doctor and say, hey, in case you didn't know it, we have brand new guidelines. You might find it interesting because they've changed a lot of things. The most important thing they changed is they're not calling this a disease anymore, that there's no disease process happening in the bladder for the majority of IC patients, unless somebody has infection or Hunner's lesions. And so for $35, you can buy the Urodapter. If you can spare the money, buy it and bring it and show your doctor, because this is going to revolutionize all these installations for everybody. And it would make it so much easier for you to do at home. Elizabeth says you can't find, oh, wait a second. You finally got an appointment with the urology office, but it's in, wait, Elizabeth, why would you go to Pennsylvania if you live in Washington? I don't understand. Okay. If you want to see one of the best doctors in the world, a master diagnostician, and you're willing to travel, great. Do it. Because if your case is complex, then you really do need a national doctor who's seen thousands of patients. So there are 3 in the United States. Okay, there is Robert Evans at Wake Forest in North Carolina, Robert Moldwin up in Long Island, and Ken Peters at Beaumont. Ken Peters is the closest to you. And he's a lovely guy. And they have a state-of-the-art women's urology center. They have physical therapists on staff. Like I send anybody in the Midwest, anybody to the West, I send to Ken Peters. He's been exceptional at finding those weird, unusual causes for symptoms. Sally says, do I know of any good urologists in the Bay Area of California? So I'm in the Bay Area. I'm up in Sonoma County. I'm in Santa Rosa. Your current urologist is mean and seems uninformed. Isn't that, you know, check our database on our website, on the IC Network website. Check our database. The top IC doctor was Christopher Payne, who is at Stanford. And then he and his wife opened Vista Urology in San Jose, but they just retired about a year ago. But wait a second. On their website, it looks like you can do a virtual consultation. Hey. Oh, $500 an hour. Yikes. Well, he was the best doc on the West Coast, so he is available, but it's cash out of pocket, not covered by insurance. I of course, would be, Sally, I would be happy to talk with you. I am the Northern California IC support group leader anyway. I mean, I'm the national IC support group leader now. I mean, I'm the only one who does national meetings, but I started out as a Northern California support group leader, and I've done it for almost 30 years next year. So if you want to chat, I'd be happy to talk with you and see if we can maybe do a little bit of subtyping over the phone to send you, see if we can find a better doctor for you. The one thing we do have in the Bay Area that's really good are physical therapists. We have amazing physical therapists. Amazing physical therapists, some of the best in the world in San Francisco, on the peninsula, in Vallejo, Berkeley, Walnut Creek. So I know we've got outstanding physical therapists for you. So our phone number, 800 number, is on the top of the IC Network website. Oh, well, it's right there. 800-928-7496. I should not have put that in orange on that. Give me a phone call on Tuesday if you want, and let's see what we can do. It's just a lot of doctors have retired. Kathleen said, I paid over $2,400 in Uber rides back and forth to healthcare since March last year. Girl, I feel your pain. Mary says, I will look into Ken Peters. You're in Ontario. There's no one here. Yeah. Danielle said, I'm going to go ask Santa for an IC membership. Great. I have a whole list of gift ideas for IC patients right on the front of our shop. There's a lot of good things that IC patients love, like chair cushions and heating pads, all sorts of things that would make great Christmas gifts. And you've got another week while we can send it. Kathleen said, I wanted to move back to Michigan. I worked at Beaumont for a year. No, no, Kathleen. Oh my God. No. Well, if you have family in Michigan, see if you can come visit for a couple months so you can get back in. Kathleen says, go to Morgan Harney. She's the sweetest and most understanding. Will do anything to help you. Didn't they have insurance? I mean, the guy who totaled your car, didn't he have insurance? Check local community foundations and even call around to car lots and see because often at the end of the year, they will pick some people to give a free used car to. And man, the squeaky wheel gets grease. Be bold. Say you're disabled. Somebody totaled your car. You're desperately trying to get medical care, but without a car, you can't do that. And ask if they have a program where they can give, because some of them have used cars that have been sitting on the lot for 5 or 6 years, and they're just kind of desperate to get rid of it, and it's a tax write-off for them. Think about it. The squeaky wheel gets the grease. Gosh, I have got floaters I had eye strain yesterday, and I started getting I get little flashes like up here and down here. Now I have floaters in my right eye. Getting old sucks. It's like, what the hell's going to happen next? That's how I feel right now. Renee says, the split pillow for tailbone pain is great. You got it from the IC Network. Yeah. Where is it? Is that it? Here it is. Is this it? Hold on. The best cushions for us, for anybody with urethral pain, vulvar pain, rectal pain, have a design where there's a groove down the middle. This is our old cushion. We can't get this anymore. The factory closed with COVID, so we are unable to get these. These were special made for us. But the way this is designed is there's a groove down the middle, and then each butt cheek has a cushion. And so we were able to replace this in the IC Network shop with another one that's quite good. It's actually better than ours, but it's a bit more expensive, but it'll last a good long time. So if I take this out of let me take this out of the cover here. So look at this design here, right? So as you're sitting on it, each butt cheek is supported, but there's nothing pushing up into your crotch area. And let me tell you, I sat on this cushion for 5 years while I was building the IC network back when I used to have a lot of pain down there. And this was brought to me by a physical therapist in Marin County, and I contacted the company, and the rest is history. Thousands and thousands of IC and pelvic pain patients have used these over the years. Unfortunately, the factory closed with COVID. So we are unable, this used to be $35. So the new cushion that we could find that's the same design, very similar design, it's going to be up in the, how much is it? Hold on, let me look. I do not remember how much it is. $79, but it's a much better fabric. It's a much better design. It's much better foam. It's going to last a lot longer than these that we had. Renee says it is great. Yeah, it's a good cushion. Worth it. It's worth it. I'm so glad. Good. Renee, I'm really glad that that's working for you. Okay, well, we've been doing this for about 2 hours now. You guys are being easy on me. Kathleen in Michigan. Oh yeah, my ex-husband of 22 years who abandoned me. Oh God, he's on wife number 4 now. I live with his sister, better than under a bridge in Denver. I'm telling you, life sure takes us in very unexpected ways, right? I fell in love with a guy from Michigan. I almost moved everything there. Almost moved everything to Michigan about 15 years ago. I mean, I was just in love. And boy, my dad, I remember when I flew out, my dad took me aside and he goes, Jill, you have to remember that people lie. And I was, all this. He was right. He was right. Ow, gosh, that's my neck again. Yikes. Anyway, the Lord works in mysterious ways. I would love to say I understand why so many things happen. I just have faith. I just have to have a very strong faith that if you have helped one person, if you can look yourself in the mirror at the end of the day, knowing that you helped one person that day, then that is a day well lived. And my grandmother taught me, she said, you have to earn your angel wings, Jill. You have to earn your angel wings. And I'm like, how do you do that? And she was like, you got to help people. And I can remember when I was in college, and I was, by the time I was in college, I was playing professional tennis. I wasn't that good. I was pretty good. Like I was ranked, but I turned to teaching tennis to make money to pay for my tuition. And I was giving a tennis lesson at the University of California, Santa Barbara to this business executive. And he goes, Jill, what do you want to do with your life? And I said, I want to help people. And he kind of very condescendingly patted me on the shoulder and went, no, you got to wait and you got to make your money first. You're going to help people when you retire. Elke said, I wonder if there's a dating site for people who can't have sex. There is. There was, but it didn't go anywhere. And that's one of the things that I wanted the website, When Sex Hurts, I wanted that to do that. Like I personally believe that the best man for me is a guy with prostate disorder. This has been a hard journey, and we have all struggled to find our health again. And I want to be with somebody who knows that struggle and who respects that struggle. Like, like I'm so weird in a way because I'm so sensitive. And one of the things that just destroys me is pine trees and Christmas trees. Oh, if I'm near a live Christmas tree for 15 minutes, I will start having trouble breathing. And I was thinking the other day, going, God, I really want a date. I obviously I don't have time right now, but I don't want to be alone. I would love to be with somebody. And I was just thinking, gosh, if they have a family tradition of a live Christmas tree, I would never be able to go to their house for Christmas. The things you think, right? And I would hate to take that away from somebody. I don't want to take I love the way Christmas trees smell. I'm just allergic to them. And I think that, the other thing too is we all have to make our own holiday traditions. We don't have to do what our parents did or grandparents did. And, when we're young and growing up, they can be very rigid, and they can be, you're doing this or else, you're going to church or else, whatever, and they take a lot of the fun away because that might not be as important for you. So what Sally said, that's why you find a nice Jewish boy. Oh yeah, totally. I love it. One of my dear, I love it. Absolutely. I'm like kind of, I have faith. I have very strong faith. I believe in guardian angels because I have mine. Nobody could ever talk me out of it. I believe that my grandmothers are with me every minute of every day. I know that for a fact. And I just don't get comfort in a church. I don't. Churches make me want to cry. They're so sad for me. But see, remember, Norwegian, Lutheran, not exactly a joyful place to be. So I have my own traditions that I want to do. And my house is decorated to the nines. And I do that because if this is my parents' last Christmas, I want them to have a spectacular Christmas, but I do it for me. So Sarah said, I had my pelvic floor evaluation for, it flared up some musculoskeletal pain from the internal exam. I go back this week for more therapy. She wanted me to go 2 times a week, but I'm not willing to upset my entire nervous system like that. I agree to once a week. I do not have a urologist because mine retired, and I would rather see a well-versed doctor than somebody who's not experienced. What a journey. Thanks for the support. Sarah, you had what I call the hallelujah moment, hon. You went and had your pelvic floor evaluation. They touched muscles. They triggered your pain. That is exciting. That is really exciting because they found it. So the question then is, what did they find? What were they touching when you triggered that pain? Don't be afraid of that pain. That's like the single most important thing that's happened in your entire diagnostic workup is that they touched something and they made your pain come. Whoa, yeah, okay, what are you touching now? And so again, I call that your hallelujah moment. So, if your muscles were really screwed up, like really massively screwed up, it's 2 times a week for a month would be reasonable. Unless if you could afford that. If you couldn't afford it, once a week should be good. But remember, your emphasis is going to be on what can you do at home? You need to be able, you have to have skills that you can use at home because you're not going to be able to be dependent on a physical therapist for the rest of your life. We have to learn how to recognize when our muscles get tight, and we have to step in and work on those muscles. And that's what I do now. And so you can tell when your muscles are getting tight literally by how you're peeing. If you can sit on the toilet and pee like a horse, your muscles are probably good. If you sit on the toilet and you hesitate or you're stopping and starting, okay, that means your muscles are getting a little tight again. And so we have to work on that. And so when you work with that physical therapist, you need to really emphasize, what can I do at home? And it's not just stretches at home. It is learning how to use a wand. That there's wands that you can use internally to get to those muscles that might be the problem. Elke, you feel the same? Yeah. Yeah. You can always tell when my neck is getting, see, I was rear-ended really badly in my 20s. And I had wicked, and I have a long neck, right? So I had wicked whiplash. And I've got this freaking trigger point. It's like, I don't know if I can show it to you. Oh, it's right there. Oh, ow. It's right there. And it's like, you see that trigger point? I have had that for 30 years. Sometimes it gets bigger. Sometimes it gets smaller. It never goes away. I just want a year with no health problems or dental problems. Please, Spirit or God, please, 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 just give me a year with no dental problems, no other problem. I just want to breathe. Mary says, a website for people with no sex. I think of it, Mary, actually, I got to tell you, there are a ton of men. There are and it's so much harder for men because if you have a disorder which interferes with your ability to have sex, it is emasculating. And they really struggle with their identity. And I have a very, very good friend who, if you're listening, I'm talking about you, who is a surgical injury patient. And he cannot have sex, and he's young. And the toll that takes on the male psyche is it's very, very challenging. So there are a lot of guys out there who have, and think about all the men who end up with prostatitis problems, or they lose their prostate and they become incontinent and all these other things. That's real. And I know that whenever I have a guy call, it doesn't matter how old they are, if they're young or old, I respect the fact that they don't have the support that women have. Because for us, we usually have a friend or two that and we have a gynecologist. We usually have people that we can talk to. For guys, it's not there. They are truly alone. And I had one of the guys I worked with, gosh, I've worked with so many men. He was in sales and he had to fly across the country, and he was on a plane and he had a flare and he was in agony, and he went to the flight attendant and said, "Can I please use the bathroom?" The flight attendant looked him up and down and said, "Sir, you're not ill. Go to the end of the line." And he passed out on the plane from the pain. He just passed out. Everything okay, Dad?
Was there a package on the front door?
No, well, that was your slippers.
Huh?
That was your slippers that I brought in. My dad orders slippers. That is his thing. Every other week, we get a new set of slippers, and most of them go back. So anyway, to any guys that are out there, listen, you're not alone. This is not your fault. You've done nothing wrong. There is no shame. There is no blame in you having any of these symptoms. I don't want you to think that you're damaged goods. I don't want you to think that you're unlovable. I don't want you to think that you're not important. You're important. Every single one of you watching this, I see doesn't change your ability to be a father or a mother, the ability to be a husband or a wife, the ability to love, the ability to care. Don't let it take that from you. You're hurt. And a lot of us, myself included, we hide it. We don't want anybody to know. You're going to have Christmas. You're going to have people come to your house. They're going to say, how are you? You're going to say fine, and you're not effing fine. Why do you hide it? Why do you hide it? We have to role model to the next generation that when somebody is not feeling well, that the family steps in and helps. Don't hide it from your kids. If you're not feeling well and it's time to make Christmas cookies, let them make the Christmas cookies. You get to say, you know what, I'm not feeling really well, but let's set it up so that you can make the Christmas cookies. We have to teach them how important it is to be there for each other. And believe me, the internet is not doing that. The internet is creating an environment of scorn. No, we can't do that. We have got to be there for each other. If you were in my support group, well, you are all in my support group now because this is a support group. But if you were in my local support group, the one promise I made is if you're in the hospital, I will come to you. If you're in the ER, I will come to you. And I did. I did. And Linda, who we've since lost, was at the hospital with a very, very severe flare. They removed her appendix. Didn't work. Then she ended up in a coma. And I sat every day for a week next to her bed in the ICU, and I did guided relaxations with her. I did the red balloon technique, where you pretend that you're holding a balloon, and it has a long string, and up at the top is a floating balloon. And you gather all of your pain from your feet, from your legs. You gather all of your pain, send it up through your body, up to your shoulder, down to your arm, up the string, and into the balloon. And you watch the balloon get bigger. Every worry you have, every stress you have, anything that's bothering you, just send it right up into that balloon. And then you let it go. And you watch the balloon float away, right? She woke up out of a coma, and I went and saw her, and she goes, what was it with the red balloon? She knew I was there. She remembered the red balloon. It was great. Oh my God, it was just, so, they can hear. So be kind, be sweet, be generous. My mother, Norwegian Lutheran, married a guy who had to be on high blood pressure meds and couldn't, but they were happily married for 10 years. Yeah. I don't care about the standards that we had 40 years ago. My grandmother said she would disown me if I dated a black man. I went out and dated a black man. He was wonderful. You're not going to tell me that. I'm sorry. Stop it. Right? And I just think we all deserve love. And love comes in many forms, many, many forms. And I've had family members say awful things. I had one family member in front of the entire family accuse me of being gay. Said, you're not married. You got to be gay. He was really hostile and aggressive about it. And I'm like, well, number one, I just broke up with the guy that I was engaged with. But I'm not going to put that. One of my best friends is gay. I'm not going to. It's ridiculous. She's lovely. I don't know. I just want us all to be open and accepting and kind. We all want, as Mary says, no disrespect, men. I'm sure for men it's just as awful. Difficult for everyone. We all want intimacy. There's no way I could think about that now. But you can sure use a hug now, Mary. I can use a hug now. I mean, I'm not sure. Listen, I had a hysterectomy. I don't have a cervix anymore. I haven't been with a guy since my hysterectomy. I don't know if I can have intercourse. I don't know. Am I willing to try? Yeah. If if it doesn't work, it doesn't work. But that doesn't mean that I wouldn't be an outstanding friend and date. And there's something called outer course, right? But we all want intimacy and we all need intimacy. And I'm not going to let anybody suggest that because I've had my health challenges that I'm not worthy. I think we have all worked our asses off. I'm stronger now than I've ever been before. I'm more caring now. I'm more capable now than I was 30 or 40 years ago. I'm also losing my teeth now. Elke says, we need more support groups. Only found one on Zoom for chronic pain in the U.S. You know, that's the thing. Elke, we were talking about that yesterday. Listen, support groups are dead right now. You're just not, there are no function. There might be, no, I don't think that there's any functioning in-person ICD support groups in the United States right now. They all shut down because of COVID. I don't think they'll start up again. I really don't. The one group, aside from the IC network, that there was one other small group that was doing meetings by Zoom. I don't think anybody else is actually doing meetings, and that's a trend we're seeing across the world, and it's daunting. It's very, very daunting. Like, for example, now that we consider IC a pelvic pain syndrome, is that going to change IC Awareness Month? IC Awareness Month is in September. Pelvic Pain Awareness Month is in May or June. Should we be moving IC activities over to Pelvic Pain Month? Probably. I mean, the challenge with IC Awareness Month is that everybody got real excited about it 10 years ago. Now we have barely any interest in it at all. I mean, like, I got one entry for a poster, whereas 10 years ago I'd have 30. And so things are changing, and we have to mobilize. We have to get back together. We have to work as a group to create more resources, because there are patients right now being diagnosed with IC who are being told that they have an incurable bladder disease when they just have estrogen atrophy, or they have a pelvic issue, or, as Lisa said when the meeting started, they have a chronic UTI. And I am unwilling to sit here and allow that to continue. There is hope. There is always hope. And the worst thing a doctor can do is take your hope away. Healing is always happening. We just have to figure out what we're trying to heal. And for those of you where bladder therapies have not worked, there's a reason why. Your bladder's probably healthy. It's probably something else. Kathleen said, my apologies for asking. It's Heather's tummy fiber. Heather's tummy fiber. And it's in the IC Network shop. Just go to icnetwork.org and go over to, click on the shop menu, and it'll take you over to our store website. Elke says, is a California Zoom the Chronic Pain Association? Honey, I've known them for years. Yeah, I chaired our state pain conference years ago. I mean, like 12 years ago, 13 years ago, I actually chaired the entire state of California pain conference. And they are not collaborative. Every time I reached out to them, I got nothing back. You know, I think honestly, I think we need a new nonprofit. Loretta says, I can relate to the Lutheran. Yeah. It's just cold. The Lutheran church service is just, it's not a warm, fuzzy service. It is cold with sad hymns, and it's quite depressing. At least I thought it was. Anyway, I think we need a new nonprofit, and I think that it needs to be dedicated to pelvic pain for patients. So not the International Pelvic Pain Society, that's for care providers. We need the pelvic pain nonprofit for patients. And I've had a lot of doctors over the years ask me, when are you going to start a nonprofit? And my answer has been, I don't have time. Who knew I'd keep my dad alive for 20 years, but I don't have time to do it. But I think that if we brought a new nonprofit in, we could make it financially viable pretty quickly. And I think, and we have the model, we know exactly what we need to do. Can you imagine having a pelvic pain patient conference once COVID, like in 2 years? Wouldn't it be wonderful to come together in person and meet each other and take classes and hear from the experts and just walk into that meeting knowing that people care and are working hard on your behalf? Because here's the deal. Every IC national organization, we are working our asses off, and the ICA is working hard too. I just don't know what they're doing, but we are all working hard to try to help as many as we can, and with very, very precarious funding now. This is like the scariest year ever for me from a financial standpoint. Why? Because the income that we used to get from clinical trials disappeared during COVID. We're going to be launching 3 new clinical trials in first quarter 23. So that's coming back, and they're quite exciting. So we're going to have some new clinical trials that you might be able to participate in. One of them will be paid. You'll be paid to participate in, and they are looking very encouraging. And we have to create an on-ramp for these new researchers. We've got to give them some early success so they'll stick to it. Many of the old researchers failed because you can't put apples, oranges, and bananas in the same study and expect success. You can't put Hunner's lesions, pelvic floor, bladder wall, estrogen atrophy, chronic, central sensitization in the same group. So every single study on treatments for IC failed but one. Hundreds of millions of dollars invested into trying to find new treatments for IC failed. Every single one. The only one that was overwhelmingly successful was a pelvic floor physical therapy. I'm talking about ones funded by our government. And so I'm excited. I can't tell you any more because I've signed confidentiality agreements. But as soon as I can talk about it, you will hear about it. And so I'm excited about that, because that's the way you get to see some of the best doctors in the world and not pay for it. And in many cases, that's how you get into the door. You get in the door by agreeing to participate in a research study. And then if you're a nice person and you treat them well, they might say, hey, stick around. We'd like to have you as a patient. Right? Especially if you're up in Canada. Getting into any of the Canadian IC studies in Edmonton at the University of, come on, what's the name of it? It'll come to me. It's where Curtis Nickel was. That was how patients got in to see Curtis Nickel, was through the research studies. Sally says, thank you so much for building this community. I really value it. I will probably be calling you Tuesday. Good. So hold on a sec. Let me look at my calendar here. So I do have a meeting, a brief meeting Tuesday afternoon. I'm going to the dentist on the 14th to figure out why my mouth is still hurting after having this tooth removed. And then I have to try to get in for an eye appointment because I got this weird light flickering right here. It comes every now and then. Started this week, and I just think it's eye strain. But anybody have experience with that? They say that it just happens as you get older, that something detaches from the retina. And if you see, I don't have it right now. It was not happy yesterday. That's for sure. No, I don't have it right now. Hallelujah. Maybe it's going to go away. Mary says, I think there's so little interest in the medical community for IC or getting to the root cause that no one really gets what's going on with them. IC is very frustrating for people to treat. Doctors do not feel successful when they treat IC. Renee, you've had that too? Yeah, it's gone now. We'll see if it comes back. I had it for 24 hours about. Anyway, so you're right. There's not a lot of interest in IC, and you have to think about it from the doctor's perspective. They don't have an easy on-ramp to success for you. They don't. And it gets very frustrating for them because I will tell you, the great majority of doctors that I work with really care about you. And it breaks their heart that they can't make you better. It's very rare that I find a doctor that is in it for the money. They're in it because they really care. And like the Rob Evans and the Rob Moldwins and the Ken Peters and those next level tier doctors too. But for that regular doctor, urologist in your neighborhood, they got no experience, and they're going to throw antibiotics at you. It's not going to work. They're going to throw Elmeron at you. That's because they might not even know about the Elmeron warning label now, and they just don't feel successful, so they don't get invested. We have to create some plans so that they can be invested. Bethany said, if I were to email you to discuss what you have tried for your TMJ, I don't know where to begin, but you're in so much pain. Bethany, the TMJ Association is phenomenal. You need to go over to the TMJ Association. I mean, they're phenomenal. They're like, they could be the best nonprofit ever created in the United States, or close to it. Definitely top 10. And I'm one of those people where mouth guards make it worse. So my TMJ was really quiet until, I dislocated my jaw once like 20 years ago. And they said that I was an opener rather than a closer. So I dislocated my jaw in the middle of the night, and I woke up, my jaw was frozen, scared the living daylights out of me. And I got it back, thank God. Finding a TMJ specialist is hard. I did find one. The mouth guards did not work. It just made it worse. And eventually it went away. But 6 months into COVID, it came right back. But the problem is that because of my SI joint, I was sleeping on my stomach. Here's what stretched out my ligaments. So, and again, you guys, TMJ is a related condition to IC. For anybody who has IC, IBS, vulvodynia, TMJ, fibromyalgia, migraines, we are in the chronic overlapping pain condition group, right? It's a central nervous system injury. That's different. We're going to, for those of us who have multiple pain sources, we're going to focus on calming the nervous system down. But here's what I was doing. I was sleeping on my stomach, which is the worst thing you can do. But I had so much pain in my SI joint, I couldn't sleep on my back or on my thighs. And I had my pillow right here. So I was sleeping like this, right? And I think that it just, without having support on this side, it just stretched the ligaments out. So every morning I gotta push it back up in the socket. It's not terrible. It's like a little tiny thump now. But 6 months ago, it was bad. And so there are some people that can handle mouth guards, and there are different types of mouth guards. And for some of us, mouth guards just made it much worse. What I'm doing now is I am sleeping with one of our heating pads. You know, we have our our bladder heating pad, the our ginger bee heating pad. And I actually put it here and I anchor my jaw with the heating pad at night so that my jaw won't slide. And it's kind of working. My doctor wanted me to tape my mouth shut. He said, if you tape your mouth shut, you won't open your mouth. And I tried that and I couldn't do it. I would like to sleep in a bed. I'm scared to sleep in a bed. I can sometimes sleep on my couch for a couple of hours, but I go right back to the recliner. If I'm sleeping in a recliner at an angle, my jaw does not start to dislocate. So heat exercises. And Bethany, listen, go to YouTube and Google TMJ physical therapy. And there are a couple of physical therapists who have excellent videos. Like I have to do this one. So I open my jaw with resistance and hold it and let go. Hold it, let it go, because I'm trying to strengthen the muscles on this side to try to hold that jaw together. Because surgery is rarely successful. You know, and again, with that whole, so what is it with these chronic overlapping pain conditions? So we now know that it's a central nervous system injury. And why does it happen? Well, what the research shows is that for about 80% of the people that it happens to, there is a major physical injury in childhood. Breaking a leg, getting hit by a car, something that has a long recovery time from. And I've worked with a lot of patients who have been hit by cars and stuff like that. It takes 14 days of pain to make the nervous system become more sensitive and create these overlapping pain conditions. Or David sleeps in a recliner. Yeah. Yep. So, but what about the other 20%? For the other 20%, it's a history of abuse or bullying. And ironically, I've told you guys the story because that also plays a role for me, because I grew up in a neighborhood with a rapist murderer here who is my age. And from his youngest years, he was terrifying. And the year I went away to college, he raped and murdered my neighbor. Okay, so we all knew it. Many people were hurt. I was hurt. And I just ironically ran into, at our grocery store, one of the guys that I went to school with. And oh my God, he was hurt so much worse than I was. He was shot in the neck. You know, but I did not leave my home without fear. From 4th grade through high school and even college. And even now, he's in jail. He's supposed to get out the year we turn 100 years old. That's what I was told. The DA told me he died. That wasn't true, but I still won't say his name. So think about what that did to my central nervous system. I left my house in fight or flight. So my brain got habituated into protecting itself. And instead of having a normal life, I was hypervigilant all the time. And this is the foundation for central sensitization and chronic overlapping pain. And I'm very comforted now. I mean, I get it now. But when it was happening to me, I just thought I was being punished because every year it was something new. I mean, I had the frequency urgency in junior high, I had the vulvodynia, severe vulvodynia in high school. I threw ovarian cysts, IBS in my 20s. I got migraines in my 20s. I got IC pain in my 30s. Something else happened in my 30s. Tinnitus, you name it. It's all happened. And when you're that patient, and you just want to have a life. I mean, I was in the fetal position in my bathroom for 3 years every morning with IBS in my 20s. Y'all were out getting married and having babies. I couldn't even have sex. I was in agony. And you become so confused and depressed and anxious, and you're in pain, and people are looking at you like you're nuts, and people are telling you that you're nuts. And you go to the emergency room and they say you're nuts, or they say this is your life, get used to it, you'll always have severe pain. And to be at the other side of that, it is now 40 years later, it was never my fault. I do not have a mental illness. I have a central nervous system injury. And all those people who said I'd live in pain for the rest of my life are wrong, because I'm pain-free the great majority of my time now. I don't have IBS anymore. I don't have IC symptoms anymore. I have TMJ, but that's the stress of COVID, I'm sure. And Bobby says, I just realized I've lived hypervigilant my whole life since I was 6 years old due to trauma. Exactly, Bobby. Exactly. And so, honey, I am giving you the biggest giant hug you have ever had right now, because isn't it wonderful to find somebody who has walked that journey and who's made it, and you're going to make it. And to be able to cast off all of the blame and all of the shame and all of the people who demeaned you and insulted you. That's why I start these meetings by saying, I am here I don't want anybody to demean you or insult you. You are hurt. I was hurt. Badly, badly hurt. And you were badly hurt. But you know what? It's over. And we have to grieve. The thing that really turned me around, Bobby, I got to tell you, the thing that really turned me around is when I went from depression to anger. I had a doctor say to me in the ER, you will forever, this is your life, get used to it. You will always live with severe pain. You will forever be a burden on your family. That is exactly what he said. You will forever be a burden on your family. And I went, whoa, wait. This is below the waist. I have 3 college degrees. I have an award from the White House. I will prove you wrong, you son of a bitch. How dare you say that to me? That's exactly what I said to them in the ER. And I went home and I started studying. I read everything I could find. Everything I could find on IC. Everything I could find on anything. And I needed that. It was hard to hear. But you know what? That changed my life. Instead of being a passive victim, I went home and I said, I'm going to prove that sucker wrong. And all those family members and everybody else who had little comments here and there, Jill, come on, when are you going to get a real job? Hey, you know what? I'd love to have a real job. I just need to get out of the freaking bathroom first, right? And so the best part of my job is when I find somebody who has walked that journey. And you've never met anybody with IC, and you've never met anybody with IC, IBS, vulvodynia. And I want you to see that you can do it. I want you to see that you are not alone. I want you to know that there is hope. And the thing about the chronic overlapping pain conditions, we know how to fix it. We know how to break your brain out of fight or flight. You just got to do the work. You got to learn new skills. It's called mind-body medicine. It's about building your anxiety management skills, because we got to get your brain out of fight or flight because you're stuck there. And remember, Celine Dion's new diagnosis of stiff body syndrome, that is a result of, according to an expert I was watching last night, very long-term stress. Stress levels far higher than that body could handle. That affects the entire central nervous system. It kind of causes a nervous system breakdown. So what are we going to do? We're going to say, okay, you know what? It's not my fault. I'm not carrying any shame anymore. Number 2, oh, okay. So my brain is stuck in fight or flight. Well, I know that because, hello, I've had anxiety disorder, or I used to have anxiety disorder for years. So what can I do to fix that? Mind, body, medicine. And the most important, Elke says here, yep, me too, molestation, full of cortisol, pelvic pain in 20s began. Yeah, exactly, Elke. So let's go through. So this is the thing I want you to remember. That hypervigilance is being controlled by the most primitive part of your brain. It's in the brainstem. There is no cognition happening here at all. You are not going to think yourself out of this. The sympathetic nervous system has one job: to save your life. It takes over when your life is under threat. So all it's doing is monitoring sensory information. That's it. What do you see? Is it your abuser or is it a puppy? What do you hear? Is it your abuser driving home? Or is it your favorite Christmas music? What do you smell? Is it a fire or is it something you like coconut? What do you taste? Is it poison? Or is it your favorite Christmas cookie? So the way that we turn off the sympathetic nervous system is by giving it good sensory information to prove that your life is not at stake right now, that it can turn off. Power down. Let's calm everything down. And the technique that I love is called I Spy. So let's do it. Let's do it. Take 3 minutes. And fight or flight will turn off for hours. Okay? We got nothing to lose. Let's do it. So all we're going to do is we're going to give our brain good sensory information, good safe sensory information. We're just telling it, hey man, we're safe. You don't need to be hypervigilant right now. Sarah says your story is singing to my story. You make me feel exactly. Isn't that great? It's so great. Okay, so let's do I Spy. I want you to pick something in your room that you like to look at. I don't care what it is. It could be a window. It could be a flower outside the window, a tree, a bird, a pet. Pick something that you like to look at. I got a big crystal hanging right here. I'm going to look at that. And we're going to take a deep breath in and a deep breath out. Okay? What can you hear right now? Besides my voice, like I just heard a car go down the street. Do you hear a TV on? Do you hear music on? Can you hear anything at all? I just want you to focus on hearing. And it's a car idling out there. Just focus on that for a couple of seconds. And you focus on whatever you hear. Okay, deep breath in. And a deep breath out. What can you smell right now? Are there any smells in your environment? I got nothing here. I got no, well, here, I'll smell this. Can I smell this? Okay, tropical, mango. Can you smell anything right now? Close your eyes and focus on the scent. If it's a fire in the fireplace, if it's dinner cooking, whatever. Focus on the scent for a couple of seconds. Okay, deep breath in, deep breath out. Last but not least, I want you to take your hand and I want you to rub it on your pants or on your arm. Just rub it back and forth. And notice the texture, like I'm wearing cotton. I love this shirt. It's soft, it's comfortable, makes me feel good. Just rub your hand back and forth on something, your chair. Okay, we're just telling your brain, hey, something's happening down there with our fingers. Okay, deep breath in, deep breath out. Okay, now comes the fun part. If you could look at anything that would put an immediate smile on your face, what would it be? Would it be the ocean waves? Would it be a beach? Would it be a snowy mountaintop? Would it be snow falling? Would it be a pet? Would it be a child coming to visit? Would it be singers? Pick something that you would love to look at. And for me, my cat, who passed 5 years ago, has been coming to visit recently. So I'm going to pick my beautiful, sweet little kitty, Sammy. So pick something that you love to look at. And let's just go there for a couple of seconds. Deep breath in. And a deep breath out. Okay. What could you hear that would put an immediate smile on your face? Would it be laughter? Would it be your favorite music? For me, Kenny Loggins, John Denver, because although I'm old. BTS. I can be young too. Well, again, a child singing, a child laughing. What would you love to listen to right now that would make you feel so great? And the Winnie the Pooh song by Kenny Loggins. Winnie the Pooh doesn't know what to do. Got a honey jar stuck on his nose. It just makes me happy. Close your eyes. Go to your favorite sound. Let's just be there for a couple of seconds. Deep breath in. And a deep breath out. Okay. What's your favorite thing to smell? Like, I love coconut. I love the smell of fresh cotton sheets. Baking cinnamon rolls wins every single time. So what is your favorite smell? Close your eyes and visualize it. So for me, I'm going for the hot, sticky cinnamon rolls. Cinnamon rolls have never tasted better than during a pandemic. Love the smell of a cinnamon roll. So let's go there for a couple of seconds. Deep breath in. And a deep breath out. All right. What's your favorite thing to taste? What do you love to eat? I don't care if it's IC friendly or not. What do you love to eat that has a great memory behind it? And again, for me, amen, hands down, hot cinnamon roll every single time. What's your favorite thing? Or coconut? What is your favorite thing to eat? Close your eyes. It's right in front of you. Oh man, that cinnamon roll is so moist and hot, and the frosting is dripping down, and it smells so good. Deep breath in. Deep breath out. And last but not least, what could you touch that would put an immediate smile on your face? What could you touch? Is it your cat or your dog laying in your lap? Is it hugging a grandchild? Fresh cotton sheets? What would you just love to touch that would make you your lover? That's okay. Close your eyes and go there. So for me, my cat Sammy's on my lap. Actually, she's on my chest because I'm laying in bed. And I love what her fur felt like. She laid on my bed for 21 years. Great, great, great memories. Okay. Deep breath in. And a deep breath out. Okay, how do you feel? You got a smile on your face? I bet you do. I bet you do. Because we have just proven to your brain that you are safe. And that turns off fight or flight. The parasympathetic nervous system has now gained control of your brain. And you will stay here for hours. These are research methods tested with guys with the worst PTSD coming back from war. Harvard University studies are amazing. They work. We can break that brain out of fight or flight. And ultimately, in the end, listen, we can't change the past. And we can't change the future right now. I mean, what we have right now is this very moment. What can I do at this very moment to put my heart and soul and my body in a better place? And that's when something like this simple mind-body medicine, works so beautifully well. Nobody's saying that you're mentally ill. No one. This is injury. And, you know, Prince Harry and Oprah did this amazing documentary on childhood trauma. I would encourage, I think it's on Netflix, absolutely encourage you to watch it. It was so revealing, these young kids coming back from war and what they were going through. Now, here's the whammy, though. There's a whammy to this that we also have to address. And the fact is that for those of us with chronic overlapping pain conditions, y'all have anxiety disorder. You can't kid a kidder because I had it too. Because anxiety is a sign that your brain's in fight or flight. And I've asked so many doctors, it's like, why does my brain go negative? I'm a positive person. You can see I'm a positive person. Why is my first thought negative? And their answer is because it's chemically easier, because you're in fight or flight. It's just that simple. So the challenge here is that we don't just have one negative thought a day. We have 100 negative thoughts a day. And every time you have a negative thought, you give yourself a jolt of adrenaline. So now we got 100 shots of adrenaline, the chemical mediator of fight or flight and stress, circulating through your body. And that's what's driving the panic. And that's what's driving the stomach ache. And that's what's driving the run, you know, running to the bathroom and feeling poorly. It's all this chemical overload from all this adrenaline. And so that's the other piece of this puzzle is we do have to break out. We have to get out of the adrenaline overload. And I took another class that taught a very simple technique to do that. So we'll do that too. Every time you have a negative thought, you get a jolt of adrenaline. And again, you're having a negative thought every couple minutes for those of you who are in the middle of this. Okay. So here's how we break. So this was a class taught by a surgeon with anxiety disorder. And the cool thing about going to the class is that when I walked into the classroom, I totally realized, oh my God, we're all normal people that had something happen to us. And that took some of the shame away. And he just said, listen, I'm not here to talk about your childhood. We're not here to psychoanalyze if something happened to you. If something happened to you, I'll make sure that you have somebody to talk to. I'm here to get you out of fight or flight. That's my job. I'm going to give you a skill to keep you out of fight or flight, because right now you are overly sensitive to adrenaline. You're overdosing on adrenaline. So how do we do that? Whenever you have a negative thought, the first thing you do is visualize a stop sign. Just stop. And you know, you're already doing that because we all get so sick of it anyway. Stop. And you take a single deep breath in and out. And that oxygen from that single deep breath renders that adrenaline chemically neutral. It is over. It is done. It will not affect you. Stop sign, deep breath. And the third step is you got to remind yourself it's a thought and it has no power. So what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. For all you know, tomorrow is going to be a very blessed day. Or what I'm saying now, since I'm going through my dental trauma, is, oh my God, Jill, for all you know, it's all going to be healed and it's going to be fine. Where the negative part of my brain's going, maybe she cracked another tooth. Maybe I have 2 cracked teeth, right? And I'm having to be very, very, very deliberate in stopping myself from doing that and going, no, that is a thought. It has no power. So stop sign, deep breath, minimize the thought. So he said, okay, that's your tip. So for the next week, that's all we want you to do. And you walk out of this room, as soon as you have a negative thought, be attentive to it. Stop sign, deep breath, minimize the thought. And I've said this before, I like chemistry. I've got 2 degrees in chemistry. I'm like, okay, I like the chemistry. I'll give it a shot. I got nothing to lose. I had my first negative thought walking out of the room. It'll never work. But I did it. Stop sign, deep breath, minimize the thought. And I did that easily 100 times in the first 24 hours. I was shocked. You know, I'd gotten so used to it, I just kind of tuned it out. But when I really paid attention, I was shocked that literally every other thought I had was a negative, scary thought. And I was being very mean to myself. Oh, you're unlovable. Nobody will ever want you. I was shocked. But I did it. Stop sign, deep breath, minimize thought. Did it at least 100 times the first day. Next day, did it about 50 times. Third day, did it about 20 times. 5 days later, once. For the first time since 4th grade, I was out of fight or flight. I was calm. I was like, whoa, I don't know this Jill. This is crazy. It felt good. I felt so good. And that is what I have done ever since. I got to the point where I would do it maybe once a month or once every 2 months. Obviously, I live in a happy place. I'm surrounded by happy things. I practice positivity. I do affirmations. I pay I make my environment as happy as I can make it. And it worked brilliantly. I went through uterine cancer, a hysterectomy, a lot of fears about cancer. I didn't have a panic attack once. I did my stop sign, deep breath, minimize the thought. And then COVID hit, and you try keeping 2 elderly patients unvaccinated alive in COVID, and the stress levels go right back up. And so now I'm back to doing it every day, once or twice a day. And that's okay. We are all under stress right now. We have all been through hell the last 3 years. To have this basic skill that will keep it from building so that we are not having panic attacks is so incredibly important. So I double dog dare you. Stop sign, deep breath, minimize the thought. You got nothing to lose but pain. Go for it. Go for it. It is so liberating to take away the shame, take away the blame, realize it was never my fault, and then learn new skills. Because it's about skill building now. And when you go to talk to somebody, it's about you saying, hey, man, I'm really not sure how to handle this anxiety. Can you give me some tips? That is the best part of seeing an expert. And so if you're struggling with anxiety, look for a class. There are tons of virtual classes. You'd be amazed. The first lottery winners in the state of California were in my class because they developed anxiety after winning the lottery. Can you imagine the guy who won $1.9 billion a month ago? Imagine the anxiety they're facing right now. They don't want anybody to know they have that money, right? So life is good. Life is good. There is hope. We've come so far. So many patients are getting better with subtyping. Now that we understand cause and effect, now that we understand that not everybody's the same, that those of you with Hunner's lesions, you need to do Hunner's lesion therapy. For those of you with pelvic floor, you got to work on your muscles. For those of you with central sensitization, you got to work on your nervous system. And things are getting better. And I'm very optimistic for the future, and I'm very optimistic for 2023. And I think we've got good things coming down the pipeline. And I hope you'll join me. I hope that you will spread some positivity now in the IC world. And for anybody you meet who's suffering, please tell them to come watch one of these support group meetings. I think today's meeting's been really good. I hope it's been good. I hope that you found it helpful. And they can watch these. So, because they're all recorded. So anyway, all right, guys. Well, listen, it's been 3 hours, and I'm very happy that my floater is gone right now, or my flasher. Let's hope it stays that way. Send me good vibes for my dental karma. I had my teeth cleaned, and the hygienist fractured roots. So I'm missing one tooth. And I'm hoping I won't lose this tooth. So life just gets very random every now and then, right? I mean, like, oh, come on. Just give us 1 year of health, please. Please, 1 year of good health. Thank you for making my day. Because you make me feel good too. And I feel pretty good right now, and I hope you do too. All right, guys. Well, listen, I think we'll call it here. If you find this helpful, please come on over to the IC Network and think about becoming a member so that you can get our magazine, the IC Optimist, because that's where we put our big stories, and all of our members get to go read past issues in their member page. We have member pages. You can do it for $25 a year. What a deal. And if you're thinking about, if you want to try chair cushions or heating pads or supplements, please come get them from our website rather than going to Amazon. Because it helps us. It really helps us. And they're cheaper. on our website usually than Amazon. So here, hold on a sec. Renee says, who cares what people think? We press on. Kathleen says, Jill, you took back your power. I did. And I want you guys to too. Sally said, this is a great grounding technique. It reminds me of the one I use with my PTSD clients. Yeah. And Sally, hey, hon, listen, if you ever have a technique that you think would be really helpful to the IC world, please let me know, because I'd love to feature your work if you're still doing that work, because PTSD is real in this patient population. Kathleen says, today was very helpful. Thank you so much, Jill. Have a blessed evening. Thank you, Donna. Thank you, Sarah. Thank you, you guys. Thank you very much. Well, be well. Y'all have a good evening. And our next meeting on Facebook hopefully will be on Thursday. And our last meeting before New Year's, it will be next Sunday, you know, if all goes well. And then there's going to be 3 weeks where Christmas is on Sunday, New Year's is on Sunday. And so I won't be doing these meetings on those days. So you'll see me again next in January. Knock on wood. Please, God, make this happen. All right, you guys. I'll see you later. Goodbye, YouTube. See ya.